Yeah.
minutes.
You can keep it very short.
Yeah.
So yeah, you can just. I'm the VP of machine learning here for the India business here, and yeah, I think that's that's
Sure.
good enough. Yeah, that'll give me some more time for my talk because I think
Yeah.
I may be a minute or two over. So
Sure. Sure.
yeah.
Definitely. So how is pandemic? Is it creating new problems for your organization as well, or new opportunities you see it as from machine learning perspective?
Well, again, online has become much more popular, so it's obviously the business for Amazon has impacted it positively. It's not a great thing what we have, but I think people are relying on online a lot. So, it's something that uh, our customers are looking forward to, and so we are definitely having to stretch a lot more to serve
Mm,
customers. And delivering with the same speeds has become a challenge. Like earlier we could deliver things within 1 or 2 days, but now it's taking 5 or 6 days because of
mm,
social distancing. A lot of uh, uh, disruptions have come into the supply chains, getting the products, making sure they are in stock. Also, social distancing has hurt throughput and so on. So, I think there are a lot of challenges that have come to the business in terms of service, but um,
yeah.
but people don't want to go out and shop, so the volumes have gone up. So it's a challenging situation, but it's a good challenge to have.
Yeah.
It's better than being in the travel business where you don't have anybody traveling,
Mm,
right? So
correct. Correct.
you've got a lot of demand to meet and so on. And I'm
You are all
sure
working from home? Sorry.
yeah, everybody's working from home. I think until June, the guidance is until June.
Oh, okay.
Just like Google and
Mm,
Yeah.
Microsoft, and I think most companies will probably extend this till March or June next year.
mm.
And productivity of people hasn't really been impacted adversely. That's what we're finding. In fact, I think people are working longer hours, so there's maybe
It,
more
it's
happening.
not
There is
24/7
a
now.
danger of burnout more than anything else, right?
I
The social.
agree. I agree. Actually, that's a serious fear that people are burning out. We're finding a lot of people, especially women, are impacted a lot more. They're leaving the workforce, switching to part-time arrangements. And this is happening across the world. It's not just in India, but probably India, women are impacted a lot more because help and maids and other things become more of a challenge, right? I
Hmm.
mean, a lot of people aren't having maids come in because of. But I think slowly people are getting back to normal. In fact, it was my daughter's birthday yesterday, and my parents who are 85 years old, we all went out to a restaurant. It was quite empty, so it was okay. But they've been locked up for 8 months. We were just talking like 8 months we didn't leave the home, but yesterday they felt okay going out to a restaurant. So with masks and everything, we went out. Hopefully, none of us gets infected, but at
Mm,
some point, you got to start living normally, or at least getting back to a little bit of normal, taking precautions of social distancing, masks, and things like that. I think slowly life seems to be returning back to normal for most folks.
And when the vaccine is on the way, Trump is telling vaccine is on the way.
mm.
Yeah,
So
it's now
Krishna,
changing actually
you
right now.
casted your vote. You are done with that, or you are busy with our
Yeah,
program?
I did vote. My TV is on. I'm watching the result. He's heading now. Highly likely by another 4 hours we'll know.
Oh, okay.
Yeah, counting is started.
Leading?
No, Trump is trailing.
Mm.
Oh,
Florida,
Here it
okay.
is. Here it is very complicated. It's very complicated math here.
how
It's
about Florida? I think Florida is the key place, right?
yeah, Florida actually neck to neck for 51 and 49% neck to neck both.
Okay.
Yeah, yeah.
Yeah, it seems like
Their math is very complicated.
everyone who has won Florida, so that's a interesting thing.
Yeah, my TV is on.
So in
Okay.
between, you can give after every keynote session, you can update us.
Yeah. Anyway,
So
for
it's
India,
good.
it should be
So I
fine.
think
Either
Sunil,
way.
let us start.
Yeah.
Sure.
Sunil, I think we are 8 o'clock.
8
So
o'clock.
I
Yeah.
will introduce
Let's-
you and then we
Sure.
can start.
Sure.
Okay.
Yeah.
So friends, a very good morning to all of you. We are having our next session, that is session 3, which is going to be on AI for social good. This is day 2 of Bangalore Technology Conclave. Yesterday we had very wonderful 2 sessions. First one was AI in industry. Subsequently, we had advances in AI, and we got a lot of perspective from very well-known experts throughout the globe. Now, today's session is going to be moderated by Dr. Sunil Kumar, who is our program chair for this Bangalore Technology Conclave, as well as he is also executive member of IEEE Bangalore section. His day job is at Ericsson. He is director data science, AI, ML, IoT, analytics, Ericsson R&D Bangalore. He is having 16 plus years of experience at deep learning, machine learning, analytics, Internet of Things, augmentation, automation. Before joining Ericsson, he was at Philips Research, and before that, he was at Infosys. He is a senior member of ACM, IEEE, as well as fellow of ITE. He is alumnus of IIT Roorkee, IIIT Bangalore, and IIM Ahmedabad. So thank you, Sunil, for accepting to moderate this session. Over to you.
Thank you. Thanks, Puneet, for your kind introduction. Good morning, everyone. It's my pleasure to welcome you for second day of our Bangalore Technology Conclave. We have a very good start yesterday, and today also we have speakers in the next 2 sessions. The morning session, which I am moderating, I'm happy to say we have representation from 4 continents. So this is the high-level agenda what we are going to have. First 2 sessions are from experts from Amazon and Google. Rajiv is representing Amazon, and Manish is going to talk after that, who is representing Google. After that, we are going to have 2 panel discussions. So one on the both of them are on AI for social good. Maybe in the first one, we are going to touch upon something on Indian native, apart from the global aspects, whereas we have going to be taken by Dijon. The same aspect of AI for social good, different perspectives. The speakers are going to join from US. After that, we are going to have 2 more keynote speeches. People are joining from Philips Europe, Hans, and even other continent of representation we do have from Australia, Dr. Rajkumar Bhuya. So we have a packed agenda. So without further ado, it's my great pleasure to introduce our first speaker, Rajiv. Rajiv don't require any introduction, but it's my humble pleasure to introduce very briefly. So he's working as a vice president of Amazon India. Prior to that, he worked extensively in Bell Labs, both US and India. After that, he headed Yahoo Labs in Bangalore as a vice president, and he's a recipient of Bell Labs Fellow, ACM Fellow, and IEEE ICDM Research Contribution Award. He's alumni of IIT Bombay and University of Texas. So it's my pleasure to invite Dr. Rajiv, who is going to talk on the COVID situation and how the crisp. Let's hear more from Rajiv. Rajiv, over to
Sure.
you.
Yeah.
You can start presenting. I'll stop.
If you can share the content, share with me, I'll get started. Yeah.
Okay, you want to share it or shall I share it? You can share it.
No, I'll share it. Yeah, that's fine.
Yeah, please.
Okay,
please.
I have it now.
Yes,
okay,
please.
Thank you. Okay. Thanks again for the introduction. What I'm going to do today is talk about the CRISP system for predicting COVID-19 infection risk scores. This is clearly a very timely topic, and this is joint work that I've done with Ralph Herbrick and Roland Wolgroff, who are at Zalando Research in Germany. So we all know that COVID-19 spreads through contacts, and a promising technology here to track the spread of the disease across the population is contact tracing. Now, contact tracing apps use Bluetooth signals on mobile phones to track social contacts between individuals. So the objective of this work is to leverage all this fine-grained contact data of individuals collected by these apps to estimate infection risk scores for individuals, or alternately predict the likelihood of an individual getting infected with COVID-19 um, due to contacts. Okay, so here are some of the key contributions. First, we propose a probabilistic graphical model for COVID-19 infection spread through contacts between individuals, and our model uses latent variables to represent the epidemiological states of individuals based on the SEIR model. We also develop a Block-Gibbs sampling algorithm to draw samples of the latent infection states of each individuals. And we assume that we are given data about the contacts and test results. The infection states themselves are latent. And then we use these infection state samples to compute infection risk scores for each individual. And these infection risk scores, as you can imagine, can be used by governments and organizations to prioritize testing. Testing bandwidth is always limited. Also to identify individuals who should be isolated or quarantined. And we carry out simulations that show that a testing and quarantine policy based on infection risk scores that are computed by our CRISP algorithm can help to mitigate COVID-19 infection spread while quarantining fewer individuals. Okay, so here's just a quick overview of my talk. We'll talk about the infection spread model, inference algorithms, and simulation results. Okay, so our model is based on the SEIR model. This is the susceptible, exposed, infected, and recovered model. We will denote the infection state of individual U at time t by ZUT. Now, when ZUT is equal to S, what it means is the individual has not been infected and is susceptible. The next state is E, when individual U is infected but not contagious. When ZUT is equal to I, it implies that individual U is infected and is contagious. And the final state is R, when the individual has recovered, is not contagious, and is sort of immune to the disease. Now, an E to I state transition depends on the number of time steps that the individual has been in the E state. So the probability of an infection state, ZUT, depends on the infection states of individual U prior to time t. And in the graphical model, we have edges into the infection state ZUT from states ZUT prime, where t prime is less than t. Okay, so our model is not Markovian. Essentially, you have these edges jumping around in the model. And we're going to use some notation in this talk. ZUT is the sequence of infection states for individual U until time t. ZT is the set of all infection states until time t. Z is the set of all infection states. Capital T here is the number of time steps that we are considering. And finally, ZU down here is the infection trace for individual U. And it's the sequence of all infection states for individual U. Okay, so here's an example trace for an individual with state transitions from S to E to I to R, right? The individual is in state S for the first T0 time steps. And here T0 is drawn from a geometric distribution with parameter P0. P0 is the probability that the individual gets infected from external sources. And then the individual makes a transition into the E state and stays in the E state for DE time steps. Here, DE is drawn from a negative binomial distribution. And then the individual again transitions to the I state and stays in the I state for DI time steps, where DI is again drawn from a negative binomial distribution, and the individual stays in the R state after that. Now, we can represent each infection trace, right, ZU, by the triple T0 DE DI. These are the three parameters that pretty much define the complete infection trace, okay? Let's look at the contact model. Let's say at time 2, individuals 1 and 2 have a contact. So then we add edges shown here between Z12 and Z23 and Z22 and Z13. So these edges get added to the graphical model. Essentially, the probability of infection state Z13, right, which is this infection state here, depends on both these states, Z12 and Z22, because once they've had a contact, this Z22 can affect the infection state of the infection state Z13. Okay, so we're going to denote the set of contacts by D contact. Each contact is a 4-tuple. UVTX, U and V. What it indicates is that U and V have had a contact at time T. And we also take into account all the features of the contact, for example, duration, distance, location, and so on. So our model is also able to say, what is the impact of these different features? Right now, people are just guessing how much location impacts, the probability of infection transmission or distance or duration and so on. And there are some magic numbers like 15 minutes you have to be in contact, or a distance of 6 feet. So our model is able to, you'll see that it can learn all these importance of these different features for infection probability transmission. So that would be a huge contribution to science. Now, the infection transmission probability for a contact is given by sigmoid of Wx. Here, W is the weights vector, and X are your contact features. Okay. So now let's look at the state-to-state transition probabilities. On the vertical axis, we have the current state, ZUT, and on the horizontal axis, you have the next state, ZUT plus 1. So the probability of transitioning from S to S is given by FUT-ZT, and I'm going to define what FUT-ZT is in the next slide. And the probability of transmission from S to I and R are 0. Similarly, we can have these probability transmissions from the other states. For example, if you see now, the probability of transitioning from E to I is GUT, ZUT, and I'm going to define this also. It's a little bit different. And it's 0 from E to S and E to R, right? And once you're in R, you stay in R, so the probability of transition to other states is 0, and the probability of transition from R to R is 1. So let's define what the S to S state transition probability FUT-ZT is, right? This is the probability that the individual stays susceptible. That is the probability that the individual does not get infected. And it's the product of these two terms here. The first term is the probability that the individual does not get infected from external sources. And the second term here is the probability that the individual does not get infected by infectious contacts it has had at time T. So for example, here, if you look at it, sigmoid Wx is the probability of getting infected due to the contact. 1 minus sigmoid of Wx is the probability that you don't get infected due to the contact. And we take the product over all contacts that U has had with other individuals at time T, and where those other individuals, V, were infected. That's given by this ZVT equals I. Okay. And so now let's look at the transition probability from E to I. So let's assume that the individual has been in the E state for n time steps. So the probability that the individual transitions from E to I is the same as the probability that the next state after these n E states, the next state is I, which is all equal to the probability that the individual has been in the E state for n time steps, given that the individual stays in the E state for at least n time steps. Okay, and that can be written as this equation here. The numerator here is the probability that the individual has been in the E state for exactly n time steps. That's negative binomial of n. And the denominator is the probability that the individual has been in the E state for at least n time steps. Okay. And finally, there's the test outcome model. So let's say the individual has 3 has tested at time 4 with outcome O34. So then in our graphical model, we have a node for O34 and an edge from Z34 to O34. Now, the test outcome for an individual at time t only depends on the infection state of the individual at the test time. Okay, so let's say we're going to denote the set of all tests by d tests. So each test is a triple, which indicates that U has taken the test at time t with outcome O, and O can be either positive or negative. So these probabilities are, again, probability of an outcome given the infection state is given by this expression, this equation here. Now the test has a false negative rate of alpha, which means which happens when the infection state is infected, but the test outcome is negative. Similarly, the test has a false positive rate of beta, and alpha and beta are small amounts. And the false positive rate happens again when the underlying infection state is one of S, E, and R, and the test outcome is positive. Okay. So now we have all the data to write down the joint probability distribution, of test outcomes and the infection states. As I mentioned earlier, the test outcomes only depend on the infection state for the individual at the time of the test. So we can write this term here, probability of D test given Z, as a product over all tests of the probability of the test outcomes, right, given the infection state. Now, similarly, all the infection states ZUT plus 1 are conditionally independent of each other given your infection states until time t, right? So you can write PZ as the product of these probabilities of ZUT plus 1, and these terms can be rearranged, and you can write it as the product over all individuals U of the probability of the sequence of infection states in infection trace ZU. Okay, and ZU, as I said earlier, can be represented by this triple T0 DE DI. So let's see what this term, further expanding this term and what it looks like, right? So the probability of the sequence of infection states in infection trace ZU is nothing but the probability that the individual U is in the S state for the first T0 time steps, the E state for the next DE time steps, and then in the I state for the next DI time steps, right? And the probability that the individual is in the S state for the first T0 time steps is equal to the probability of S to S state transitions in the first T0 minus 1 time steps. And that's where you get this term FUTZT. Followed by an S to E transition, state transition, right, in the T0 time step. And that gives you this term 1 minus FU T0 ZT0. And similarly, one can show that the probability of the individual being in the E state for DE time steps, which is this term here, is equal to the probability of E to E state transitions in DE minus 1 time steps, which gives you these terms here. Followed by an E to I state transition in the D time step. And that gives you this term here. And if you look at this expression, a lot of terms cancel, and what you get is this negative binomial of DE, which is what you see here. Okay, so this is what the probability of an infection trace for individual U looks like. Okay, so now we can go on to the inference algorithms. Now, the goal of inference is to compute infection risk scores for every individual at each time t. For this, what we need are these, posterior distributions of the infection states Z given the test outcomes. And using Bayes' rule, this term can be rewritten as this expression on the right-hand side here. The numerator is a joint probability distribution of Z and D test, and the denominator here is the normalization factor that sums this joint probability over all the infection states Z, right? Clearly, this normalization factor is intractable, so we don't have a closed form for this posterior distribution, and so we rely on approximate inference. Now, so we approximate this posterior distribution using Block-Gibbs sampling. We draw samples of the infection trace ZU, keeping the ZV for the other individuals V fixed. Okay, so essentially we draw samples from this conditional distribution, conditional probability distribution PZU given ZV V not equals U. Okay, and this unnormalized conditional distribution has three factors that depend on the infection trace ZU. The factor AZU captures the temporal evolution of the infection state changes of infection trace ZU. This factor BZU captures the infection states of other individuals V that are impacted by the infection trace ZU. And then you have this factor CZU, which is nothing but the outcome of tests on individual U. So we can enumerate all possible sequences of infection traces ZU for individual U, and then we can normalize these probabilities by dividing by the sum over all the infection traces. Now, we saw that we can represent each ZU by the triple T0 DE DI, so the total number of infection traces ZU is equal to the number of triples, which is order capital T, which is the number of time steps. And we get order T and not TQ because DE and DI have some max values. You can only be in the exposed state for 14 days, and you can only be in the infected state maximum for 38 days. That's what the data shows. So here's our Block-Gibbs sampling. In every iteration, you pick a random individual U, you enumerate all possible infection traces, you compute these unnormalized conditional probabilities, and you then sample an infection trace as shown here with a probability that's proportional to the unnormalized conditional probability. Okay, and you repeat this until convergence. So now we can easily compute these infection risk scores. We use our Block-Gibbs sampling algorithm to draw these samples of infection states for all individuals, Z1 to Zm. And then now you can compute the infection risk score for an individual U at time t by taking the fraction of samples Zi in which the latent infection state ZUT is either exposed or infected. Okay, so that's once you have these samples using Gibbs sampling, you can compute infection risk scores, which is the likelihood that you're going to get infected with COVID-19 for every individual. So this is super powerful. Now you can take all sorts of interventions like testing and quarantine based on these infection risk scores. Okay, so let me just show you some simulation results. Now we compare different testing and quarantining strategies along two dimensions: number of individuals infected, of course, and the number of quarantine days, number of days that individuals are quarantined. This is extremely important because it captures the economic cost of the strategies, right? You want to quarantine as few individuals as possible, and you want as few infected individuals as possible. And here we simulate the spread of COVID-19 using our CRISP model. So at the time of every time step, we query these testing and quarantining strategies for the list of individuals to be tested and quarantined. So for all individuals who need to be quarantined, we delete the contacts into and out of them. And then we simulate the infection states for all the individuals in the current time step based on their infection states in the previous time step, the contacts that they've had, as well as the transition probabilities that we have defined in the CRISP model. We also generate the test outcomes for individuals who are to be tested. And, for some individuals may transition from the E to I state. We select half of those individuals who have just become infected to be symptomatic. That is, they show symptoms. The other half don't show any symptoms. Okay, so we found that only around 40% of actually 60% of individuals show symptoms, 40% don't show symptoms. And then we reveal the test outcomes of all these individuals to be tested and also the list of individuals who are showing symptoms to these testing and quarantining strategies. Okay, so here are three testing and quarantine strategies that we considered. The first is a symptom-based policy. So anybody who shows symptoms, we go ahead and test it up to a capacity of 10 per day. And those who test positive, we quarantine them. Then there is a contact tracing policy, which again will test up to 10 symptomatic individuals. If there are fewer than 10 symptomatic individuals in a day, you fill up these tests with quarantined individuals, ranked based on the number of contacts that they've had with COVID-19 positive test cases. And everybody who tests positive and all their contacts that they have had over the past 7 days, you quarantine them. Okay. And then there is our CRISP model-based policy. So here again, we test up to 10 symptomatic individuals per day. We compute infection risk scores using our Gibbs sampling, Block-Gibbs sampling algorithm. Now, if if we haven't filled all the 10 tests, which is our testing capacity, we consider those individuals who have the highest probability of being infected, and we test them. We put all individuals in quarantine whose probability of being either exposed or infected is greater than a threshold, and we release all individuals from quarantine whose probability of being susceptible or recovered is greater than a threshold. Okay, so these are the 3 quarantine strategies. In our simulation, we have 1,000 people. We have an infection transmission probability of a contact of 0.025. And here is a curve where there's no policy that we have put in place. And it plots the number of susceptible, exposed, infected, and recovered individuals as a function of time. On the x-axis, you have the number of days. On the y-axis, you have the number of individuals. This green curve is what is important. It's the number of infected individuals. You can see that it peaks around day 100, and you have over 200 infected individuals. Okay, so that's the part of the simulation, and actually 20% of population is infected. Here, the contacts are generated randomly. So every individual can contacts every other individual, 10 other individuals or so in a random pattern. Okay, so here you can see the effect of different quarantine strategies. So let's take the symptom-based policy first. You can see this curve, the green curve here, the number of infected individuals is quite large. And this is because the symptom-based policy only tests individuals with symptoms and only quarantines individuals who have tested positive for COVID-19. As we saw earlier, 50% of infected individuals are asymptomatic. Now, none of these individuals, asymptomatic individuals, are either quarantined or are quarantined by the symptom-based policy. So these asymptomatic individuals go around spreading infection throughout the population. Now, if you look at the contact tracing policy, it does quite well. It keeps the number of infections to be quite low. But you can see the number of quarantines days is quite high. So it ends up quarantining quite a lot of individuals. And this is because the contact tracing based policy quarantines all individuals who have come in contact with a COVID-19 positive test case. Now, some of these individuals may really have low infection risk. For example, if some individuals may have come in contact with an infected person during the period when the infected person was in the E state, and so they weren't contagious, right? So the E state is there for 5 or 6 days. So after getting infected, you're not contagious for 5-6 days. And now you can see the final curve here with our CRISP-based infection score based policy. It keeps the number of infections to be low, and this is because it quarantines all individuals with high infection risk scores, and this includes asymptomatic individuals as well. So you don't look at whether people are having symptoms or not. Everybody who has high infection risk scores are going to get quarantined. It also keeps the number of quarantined individuals to be quite low because it only quarantines individuals with high infection risk scores. You don't quarantine anybody unless their infection risk score is high. Okay, so with that, I'll just go ahead and conclude my talk, and I'm willing to take questions. So I've proposed, shown you a probabilistic graphical model, which does fairly realistic model based on the SEIR model for COVID-19 infection spread. It captures all these infection states of individuals. These are hidden. They're captured as latent variables in the model. The infection risk scores can be used to proactively test and quarantine individuals with high risk of infections, and this can help to mitigate COVID-19 spread. I mean, there are some future directions for us. We've right now done all our experiments and inference using simulated data for contacts and test outcomes. We would love to do this on real data, but understand that it's not so easy to get access to it. But we are in the process of doing some experiments. Also, Gibbs sampling is computationally expensive and does not scale. So we'd like to look at faster inference methods such as belief propagation and variational inference. And finally, we assume that all the test outcomes and the contact data is available at a central location. This may not be realistic for privacy reasons. So we want to extend our CRISP algorithm to a federated setting where all the contact data and test outcome data will only be stored on the mobile device of the individual. And the mobile devices will exchange messages with each other with the infection trace samples for individuals. And these messages will be exchanged between mobile devices that have come in contact. So that's work in progress. So with that, I'm happy to take questions.
Thanks, Dr. Rajiv, for on a early morning. We started with interesting math, and then we went into the simulation results. Some of the questions are even answered there as a federated learning setting, which is work in progress. But we do have interesting questions from the audience. I may not be able to take all of them, but let me pick one or two interesting questions. Let's say, how the model incorporate the herd immunity? So, have you thought through that?
Yeah, I mean, it does. If you look at actually, if you simulate using CRISP, you will see that the infections go up at a certain point due to time constraints. I couldn't show the all the all the graphs that we had. But if you look at that chart where there was no policy in place, you saw that the infections would go up and they peaked around day 100, and you had about 20% of the population infected. So on a single day, by the way. So you are going to reach herd immunity at some point where if you have no policy in place, the number of infections will grow. And then over time, you saw that the infection curve did come down, right? So the number of infections start falling down and actually go down to zero. So with no policy, you are going to, but you're going to see a large number of infections at peak, in our simulation. But of course, our simulation wasn't very realistic. We assumed everybody in the population interacted with everybody else with some random chance. So these numbers are very sensitive to number of contacts and also who can randomly get in contact with whom and so on. So typically we have some locations, right? We have some spatial proximity and those sorts of constraints that come into contacts. So we need to also look at more realistic simulation models. But herd immunity will come in if you don't have any policies.
Interesting. Maybe one last question, and remaining questions we will mail it to you so that we will be happy to get your inputs. Because we are getting into the winter season or even the festival season kind of a thing, that will the change in the patterns, are you seeing it, or do we need to change the model, keeping the large gatherings which may come in?
No, the model doesn't change. The model only specifies, the state transitions, which is SEIR. Susceptible, exposed, infectious, and recovered. So that model is quite robust, and the state transition probabilities are also very robust. So the entire model, the machinery is the same. What will change are the contact patterns for people, right? So and the test outcomes. The strategy will determine how you test. The contact patterns and the test outcomes are the two inputs to the model, and those will change with if you have a festive season, then the contact patterns are going to become a lot more contacts between people because people will be in large gatherings and so on. So the contact patterns will change. And then, the test outcomes and the testing strategy will change, and the quarantining strategy will change depending on what strategy one adopts. Do you do contact tracing based quarantining, or do you do symptom based quarantining? So people have different views on all of this, right? And also doing contact tracing is not easy, right? Right now it's all manual. We don't have Arogya Setu is not on everybody's phone and it's not turned on. So we don't have a big contact graph and so on.
Yeah, interesting. So let me take the opportunity to thank you from IEEE, and we do have other interesting questions. We will definitely mail you and expecting your response on that.
Thank
As
you.
a small token of appreciation from our side, this is a virtual flake from our side.
Thank you.
And
Thanks a lot. Thanks for inviting me. Thank you very much.
Thank you.
Yep.
Thanks a lot. So with that, so it's my great pleasure to invite Dr. Manish Gupta, who is the director of Google Research India, and who is going to talk on a similar topic on transforming healthcare via artificial intelligence. So he worked previously in Videocan, and then he led teams from research centers, Xerox and IBM in India, and he's an alumnus of UIUC. He has a very good track record of 75 papers, which has more than 7,000 citations and granted 19 US patents. And he has so many awards to his credit. A few to mention, he's a distinguished alumnus of IIT Delhi and ACM Fellow, and even he's a member of Indian National Academy of Engineering. Dr. Manish?
Thank you. Can you give me share?
Yeah, sure. We will give you the permission. Let me stop sharing. We'll make you presenter. We can see that.
We can
Manish.
see your slides now.
So Manish, you will be having around 20 minutes per presentation, so that at least we can accommodate a couple of questions.
Sure.
Please.
And you're able to see my slides? I've shared my screen for simplicity, because otherwise run into trouble. Okay. So thanks for the opportunity. I'll talk about transforming healthcare through artificial intelligence. And I'll start by pointing out that there's not a single country on the planet which is happy with its healthcare system. And you can look at different countries, and they're all dealing with problems which have some similarities and, of course, some differences. So so on this slide, I've shown plots of the per capita expenditure on healthcare in different countries. And topping this chart is US, which was already in the year 2018 spending over $10,000 per person per annum on healthcare. And this is not when a person falls sick. This is the average spend. So, and the number continues to rise. So, sorry, I have this formal data from 2018, but yeah, the numbers continue to rise from what's indicated in these charts. So US realizes this is not sustainable. Then you have countries like UK, where the costs are much lower, and in some sense the outcomes in terms of life expectancy and so on, you could argue, are actually better than the US. But even a country like UK is really struggling to figure out how to reduce its healthcare cost. And on this slide, there's one country which doesn't seem to have this problem of very high average cost, which is India. And somebody who's not familiar with India might think we are doing something great, but we know the reason our average costs are so low is because much of our population doesn't have access to decent healthcare. Now, the challenge is that if we go about, I mean, for those of us who are, let's say, attending this talk, we are the privileged ones who do have access to decent healthcare. Our numbers and our trends very much look like those for the developed economies like UK, US, and so on. And if, as India built its healthcare system for all, if we were to simply follow the lead if we were simply to follow what other countries have done, we would really end up with a completely unaffordable system. So we really need to do something very different. So what's that different? And in my view, that's the leapfrog opportunity for India to really build its healthcare system the right way. So there are two elements to what that better healthcare system could be. One aspect, which is more business model change, and I won't talk about it that much, is to make it more consumer centric, where there's an inherent incentive for their healthcare system to deliver value to the patient as a consumer. there isn't an inherent incentive as it is in, for instance, with healthcare providers, right, to provide expensive treatment and so on. So that's the business model change. The other part which is needed is to make healthcare more proactive. And this is where AI can make a significant difference. So what do I mean by making healthcare more proactive? There's a well-known saying, prevention is better than cure. And we just heard the talk by Rajiv, again, in the context of COVID, right? Again, prevention is really the best strategy, right? It's best to try and prevent yourself from getting COVID. And of course, yes, if you end up with COVID, yes, you have to go for the proper treatment. But this particular argument of prevention being better than cure can be applied to all of the different tiers of the healthcare system to achieve better outcomes and lower costs. And this is where AI can help. So let's start with the most expensive tier in a healthcare system, which is the ICU of a typical hospital. If you can prevent a person from having to enter the ICU, you can actually lead to better outcome for the person as well as lower costs, because ICU is a terribly expensive place to treat a person. And of course, there's something more expensive than money, which is life. So if a person has entered the ICU, again, AI can help us predict complications. And through those predictions, doctors can pay special attention to those likely complications and save those lives. And as I mentioned, if you can now predict a person while they are in the normal ward of a hospital, that they are likely to have complications and prevent them from having to go to the ICU, that's even better. At the primary healthcare setting, if you can screen for various diseases like breast cancer, various forms of cancer, breast cancer, and so on, where early diagnosis is really the key to better outcomes. Again, you both lower the cost and you improve the quality. And taking that argument even further, if we can take care of people when they are living their normal lives at home and at work, and prevent them from, again, falling sick, that leads to even better outcomes. So that's where I believe the real action in healthcare in the future would be before you get to the hospital. And that's where we have a real opportunity in India to build a much better healthcare system than the sick care system that we have all over the world. So I'll give now a few examples of how AI can be applied to make things more proactive. So let's start with the canonical, with some examples of how AI can help you screen for potentially dangerous diseases. And this applies to various forms of cancers. And again, there's been a fair amount of work done both at Google as well as outside Google on coming up with AI-based techniques for screening for things like breast cancer, lung cancer, and so on in particular. So I'll take the example of screening for diabetic retinopathy, which is a work that was done initially in India, and now it is being taken to other parts of the world. So the problem of, so why is diabetic retinopathy relevant? It is one of the growing causes of blindness of people, and it potentially affects any person with a diabetes condition. And India happens to be the diabetes capital of the world, with a very large number of people with diabetes and a growing disease burden of diabetes. Now, early regular screening is really the key to preventing blindness, because if you can detect this condition of diabetic retinopathy early, the treatment is relatively straightforward and you can prevent blindness. But what happens in a country like ours is there's a shortage of eye doctors. For that matter, you pick any specialty and you will find, yes, there's a shortage of doctors with that specialty in India. So what ends up happening is that in India, 45% of the patients end up suffering vision loss before they are diagnosed with this condition. So, and how's this condition diagnosed? Basically, you take images of the retinal region with a special camera called retinal fundus camera, and the ophthalmologist basically analyzes these images and they look for signs of hemorrhage, which show them that yes, there is the disease which is prevalent. And then they grade these cases on a 5-point scale. 1, which is representing no diabetic retinopathy, all the way to 5, which would represent proliferative diabetic retinopathy. So what we did was our researchers led by Varun Gulshan and then colleagues in the US. So this is work that Varun started in India before our research lab even existed. He had moved for personal reasons, and he started this work in partnership with Arvind Eye Hospital and Shankar Netralaya. So we asked their doctors to share with us, again, label data, where we got these images, as well as the doctor's diagnosis for these images. Now, of course, in some cases, we found differences of opinion on the same case amongst different doctors. And for that, we worked out a particular adjudication protocol where we would ask, invite retinal specialists to independently weigh in on those cases. If they agreed, then we would take that as the ground truth. If they didn't agree, then we would ask them to talk to each other and come to a consensus opinion. And that was taken as the ground truth. So with that, again, a Inception V4 based architecture, which has been used previously, right, in the context of image classification, right, distinguishing between is this an image of a cat or a dog, which is, again, one of those use cases that really brought deep learning back into prominence, right, the whole field of artificial neural networks, which, again, the techniques had been around for decades, and it was on these image classification tasks that deep learning techniques showed huge improvements and made a comeback. So with extensions to that work, with that 26-layer architecture, our researchers showed that they were able to come up with reasonably good diagnosis from the algorithm. And they published this work first in the year 2016 in the Journal of American Medical Association, a very reputed medical journal, where they showed results comparable to a general ophthalmologist. And this received a lot of attention from the medical community, including quotes like "the study by Gulshan and colleagues represents the brave new world in medicine." And earlier this year, this paper was rated amongst the 10 best papers of that journal in the last decade. And this is a photograph of Varun. And then the team went on to further improve these results and showed in the year 2017 results comparable to retinal specialists. And now we are working with these partners to now do deployments of this technology in the real world. And what I would caution is that sometimes we get carried away with the hype of deep learning. I think it is important to both recognize the potential that on one hand, again, we are seeing really, really impressive results through technologies like deep learning. On the other hand, there are also outstanding challenges. And one of the challenges that I would say where there is still a lot of active research being done is how to deal with these out of distribution cases or corner cases, which are very different from the data that the deep learning model has been trained on. So what happens with, and again, people also say, look, even humans make mistakes. But one of the things that happens when humans are presented with a complicated case, let's say a complex case of diabetic retinopathy, usually the human doctor would know that this is a complicated case. And then often they would say, okay, let me go and also consult some colleagues for a second opinion. Whereas a deep learning model would often, on these out of distribution cases, very confidently make a mistake. So how do you better estimate the probability of these models, which is known as the problem of calibration? That itself is a very active area of research. And again, there is a lot of work being done within Google, outside Google, including at our lab. So at our lab, we are working on this problem in the context of some vision related tasks, together with Professor Sridhar Devarajan from Indian Institute of Science. Let me move to another example, which is representative of monitoring from home, taking care of people when they're living their normal lives. And this, I believe, again applies to a whole bunch of different, especially non-communicable lifestyle diseases, where we believe with all these mobiles, wearables becoming popular, but certainly we already see a lot of heavy use of mobile phones, which carry a whole bunch of sensors through which you can monitor different kinds of aspects. You can monitor the body vitals of an individual. You can monitor various activities. What is this person eating? Is this person smoking? Is this person doing exercises? And things like you can try to infer the state of mind. Is this person under stress? And you can infer various environmental conditions that the person is living in. And with those, in many cases, we need to apply AI to these raw signals themselves to infer meaningful health signals. And then by analyzing these health signals, you can start to build risk models for various diseases. And both, not only risk models, you can also now suggest interventions that can either prevent that disease or at least provide an early warning to the person to go for medical intervention so that they can treat the disease at an early enough stage. And in many cases, again, you need to engage the person kind of in a dialogue so that they take that proactive action. So one example of this kind of a framework that we are building is for prevention of and management of cardiovascular disease, which is the #1 killer for people, again, in the world. So one unfortunate aspect of, again, cardiovascular disease, which leads to things like heart attacks and strokes, is that often people, especially in a country like India, it is estimated that close to 80% of the people who have a heart attack, they're actually unaware that they are at a high risk of these adverse events. The silver lining here is that there is, I mean, if only this person, you could intervene early and get these people to change their lifestyle, and things like getting them to exercise in a regular manner, getting them to limit their salt intake, for instance, to no more than 5 grams, eat the right kind of fruits and veggies, quit smoking, have keep their blood pressure under check, ideally through lifestyle modifications. If not, take medication as needed. You could dramatically lower the risk of this individual to these adverse events like heart attacks and strokes. And one of the cardiologists that we are working with, Dr. Santosh Satish from JIPMER, his estimate is that on an average, people who are having these heart attacks and strokes in India, on an average, they could delay those events at least by 10 to 15 years, if not prevent them entirely, by these simple lifestyle modifications. So where is AI involved? So AI is needed at various steps. Again, I mean, in the interest of time, I won't go through, and this is also work in progress. So one of the things you can do, you can apply computer vision techniques, for instance, to photographs of the food. If you are able to convince the user to share photographs of the food that they're eating, you can actually do a reasonable estimation of the salt content. Not that salt will show up in the photographs, but by classifying the food. Is this a salad or is this a samosa that you're eating? And if this is a samosa, I mean, you can, while you cannot absolutely infer if it's been prepared with low salt and so on, but if it is prepared in a typical manner, then you can estimate how much oil, how much salt it is likely to have. Things like that. Through this, again, our goal is to, if the person has hypertension, try and get them to go for these lifestyle modifications through which they can actually even lower their blood pressure. And if a person is a primordial patient, that is, they are at a high risk for these diseases but do not have these symptoms yet, again, you can enable them to live healthier lives. Now, an obvious concern which arises when you take such approaches is, are you being too intrusive, right? That are you kind of really observing all kinds of sensitive data about how the person is living? And that's a kind of a very rightful concern. And one of the things we are exploring is the use of technologies like federated learning. Federated learning is again something that got invented at Google Research, but is now being used by many, many companies, many academic groups who are doing research. And the idea behind federated learning is very simple, and the motivation is also simple, that, for instance, for this health scenario, instead of sharing that very sensitive data, which has been captured on the mobile, instead of sharing that sensitive data with a cloud, with a centralized server, can I get an assurance that this data will always remain only confined to my mobile device? So what happens with federated learning is that you have initially a model that's built with proxy data centrally, which is distributed on all these devices. And then you have on-device learning that happens, where on that device, you're only seeing the data for that particular device, and you start updating your machine learning model. Now, the obvious drawback, if you were to just stay only with that, is how do you learn from the richness of data across all these millions of devices? And that's where you do this learning in a federated, distributed manner, that you, instead of sharing the raw data, you only share certain parameters, like the gradients in these gradient descent algorithm that you might be running with your artificial neural network on that device. And as you share these parameters, there's again a centralized computation where you now start building a central model or updating that central model, and then you distribute back that learned, that updated model onto these devices, and the cycle repeats. So through this, again, that's a very powerful paradigm through which you can now offer those assurances of privacy, but still do machine learning over all of that rich data. Now, again, an obvious concern that arises even, so for somebody who's familiar with attacks on machine learning systems, they might point out that now the centralized model, even though I've not shared my sensitive data, the centralized model that's been learned, it may remember my individual data, and it may be possible to recover my individual data through an attack on that model. And this is where the idea of differential privacy comes in, that you can apply in addition to federated learning, where again, by various techniques like adding some random controlled noise, you can ensure that the centralized model is unable to remember an individual's data. So this approach, we believe, is very, very promising, not only for cardiovascular disease, but for a whole bunch of other diseases, which are lifestyle related, where again, things like diabetes, where you can ensure better outcomes by monitoring individuals and advising them. I know I'm out of time, so I'll maybe just wrap up in 2 minutes. I'll give you maybe one final example of our work in the public, in the area of public health, where we've been working with NGOs as part of our AI for Social Good program. So one of the NGOs that we have worked with is called Arman, which is very focused on maternal and child health. So these are very sobering statistics that Arman shared with us that India accounts, so a woman dies in childbirth every 15 minutes in India. A very, 2 children under the age of 5 die every minute in India. These are really sobering numbers. And Arman is trying to do something about this huge problem. So what they're doing is they have this free mobile voice call service. So for expecting mothers, so they enroll expecting mothers in this program, and they deliver these voice messages. Every week of the pregnancy, there are 2 messages that get delivered through a call, and a short message is played. And they have seen that women who stick with this program, they end up with better outcomes. However, roughly half of the women end up dropping out of the program for various reasons. So they pose this problem: can you apply AI to help us identify which women are likely to drop off? So together with researchers from IIT Madras, Professor Balaraman Ravindran and his team, we developed and deployed these models in production at Arman. And these models have shown, and when we have evaluated these models, we have seen that they have been able to predict over 80% of the women who were actually dropping out as high risk. And what Arman is doing is now they are using this model to reach out to those women at high risk of dropping out in a special manner through people who call them, and they are now trying to measure how much are the outcomes improved as a result of this AI-based intervention. And we are also very excited about scaling this program. So today, this program covers about 300,000 women across multiple states. We are now gearing up with Arman to scale this program to the Government of India Kilkari program, where next year we hope to work with over 3 million women under this program. Again, in the interest of time, I won't go through all of these. I mean, as impressive as these advances are, there are still a huge number of challenges, which in my view, again, present amazing opportunities for researchers to work on AI problems in the context of healthcare, things like noisy data, how to preserve data privacy, a huge problem of class imbalance that you always end up encountering, issues of fairness, safety, which I talked about in the context of diabetic retinopathy, and explainability. So let me stop here, and again, I can take a few questions.
Thank you, Dr. Manish, for your wonderful presentation. We completely agree with your point saying that even though we are talking about COVID, what happened to our high-risk diseases like diabetes or the blood pressure or even cardiovascular diseases, especially in Indian context, right? So, and I completely agree with you because even I worked in Philips and I am able to connect to the research challenges what you are talking about personally as well. And definitely the proactive and consumer-centric is the way forward for India, even for the other countries. So in the interest of time, let me take one question. It's good to see the research which is developed in India and published in prestigious journal in US, but the same model when you are trying to deploy in different geographies, how are you handling the data drift or maybe the different distribution patterns?
That's a very good question. And this also relates to, I mean, sometimes these issues show up in the form of fairness, that are your machine learning models doing the right thing across all different groups? So what is very important is for especially with deep learning methods, right, which tend to show poorer results on out of distribution data, is to make sure your data is very, very representative. So before you start deploying, let's say, the models that have been developed, let's say in India to a US population or vice versa, because vice versa is very, very common. Often there is research that gets done in developed economies, and then you're looking at deploying them in a country like India. It is very important to now look at the actual data and make sure that these models are trained. So one of the things that has been done as part of our fairness research at Google is there are these tools that we have been releasing in TensorFlow, which will help you assess how representative was your data that your model was trained on. So they will point you to potential kind of blind spots that you may have, that your model may have. So that part is very important. And then, of course, sometimes there are kind of certain protected groups where you want to make sure that you're not, that your model is not kind of doing a bad job. So sometimes there are constraints that you may want to impose. So there is also work being done on things like, and we have released like TensorFlow constraint optimization library. This could be in the context of perhaps things like financial services, or let's say you're shortlisting candidates for jobs and so on, where you're trying to ensure that your, let's say, false positive across women and male candidates are roughly equal. So there are those constraints that can be imposed. So yes, this whole issue of both fairness of data and safety of these models when it comes to sensitive applications like healthcare, that's a very active area of research. So I would say, yes, there's been progress, but a lot more work needs to be done.
Thanks a lot, Dr. Manish. We completely agree with the challenges what you posed for how the AI can impact the healthcare system. I'm sure all of us can work for AI for social good and building the better world and giving the good healthcare system for the people around the world. With that remarks, so let me take the opportunity from IEEE Bangalore Technology Conclave to thank you, and this is the virtual flake from our side for your contribution to us.
Okay, thank you. So do I get an image
yes.
to me?
Yes.
Thank you.
Thank you. Thank you very much, Dr. Manish.
Thanks.
Sure. So as we see in the agenda, we have 2 power packet sessions, which we started with in our day. And now after that, we are going to have 2 panel discussions, and which we are going to start. We are already ready with our wonderful panel members. So it's my pleasure to moderate this particular panel before I invite the second panel from Dijon. So what we are going to talk in this particular panel discussion next 40 minutes is AI for social good, the theme for this particular session. So let me introduce the speakers who are going to be the panelists. And if you see the diversified background, what we are going to have here is we have a doctor with us, and we have a venture capitalist with us, and we have a proven startup person here. So let me introduce Ankush Shabarwal, who is the co-founder of CoreOver.mobi, and he has interesting background of building the SaaS products. And in last few years, he's building Asia's best conversational AI platform, which already have over 250 million users. From the academics perspective, he has MS from Plenary and MBA from ICFI. Next, we have Dr. Venkateshwaran, who is having actually wearing 2 hats, I will say. So he's actually a strategic digital and healthcare advisory leader, and he's working in the software industry from IBM, CSC, and now with Deloitte. And he's also wearing another hat as a founder of Healthcare India. He's a doctor by profession and had his MBA in medical field from IIT Ghaziabad. Welcome, Dr. Vikram. Next, we have Pranav Pai, who is a founding partner and chief investment officer at 314 Capital, an early stage venture capital fund based in Bangalore. Coming to his academics, he has done MS from Stanford University. It's my pleasure to welcome or introduce these wonderful panelists to all of you. And let's take up the interesting question to start with. Let me stop the screen here so that at least we'll be able to see on full screen. Let me stop sharing the screen. Yeah, I can stop sharing, right? So that you will be able to see the panelists. Yes. So here are our wonderful panelists. So let me start with a starting question. What comes to your top of your mind when we are talking about AI for social good? So let me start with you, Ankush. You can unmute.
Yes. Yeah. Hi, everyone. Hi, Sunil. Yes. So, of course, whenever we do anything, social responsibility is very, very important. if you see when the raise event had happened, right, so that has attracted global attention. We could see, right, more than 70,000 people attended, and Honorable Prime Minister himself chaired that event. So he was saying when we mix AI with social responsibility, we get AI with human touch, right? So people do not want to talk to the bots, right? People do not want to interact with the bot and take suggestions from the bot and change their life or do any action in the life. So we have to be as human as possible when it comes to any bot or any AI product. And so any AI product is as good as the data you have, right? In the previous session, Dr. Manish was talking all about machine learning models, right? The technology is there. Technology was there even a few decades ago. So what has changed and why we all are talking about AI is, of course, one aspect is the cost, but people had money even earlier also. So I think it's not just the cost, it's about the data we have, but I think we need more data, right? So we would get more data to have better AI products only when we create the applications and reach to the bottom of the pyramid, right? So if you have to reach and give our products to next 500 million users, if I just talk about Indian context, we need to understand that, and we should build the products which they use, right? I often give examples. Say my mother is a retired teacher. She talks to me, she talks to her friends, but why she cannot do online banking? So I think it's because the way she talks to us is different from the way she has to interact with the banking system. But on the other side, right, if you see the people on the top of the pyramid and the technologies, banking systems are very robust, right? I don't see any changes required in the banking products, right? Only the interface, right? If we give any existing product, whether it's a banking, a telecom, or any consumer product, same products, but just have an interface where my mother can talk to the system in her own language by voice, the way she talks to us. So then adoption would increase. So by increasing the adoption is definitely they getting benefit out of it. But now in this context, I'm saying when the adoption increases, we get a lot of data. Now we all are playing, whether it's Google or us or anyone is playing with the same data, right? So now you have to go to the next level, have the products, increase the reach so that we get more data, so that we can help the citizens. So I think
thank you, Ankush. That actually reflects where your area of expertise is. We'll talk in more detail once I hear the perspectives from Vikram and Pranav as well. Vikram, what comes to your top of your mind when we talk about AI for social good?
I'm heavily biased because outside of healthcare, I don't know much, and I have, and that is by design, right? Because everybody is an expert nowadays. It takes you just 2 weeks to become an expert on COVID-19 and epidemiology, while my colleagues have spent their entire life and are still trying to figure out the virus. So I'm going to take this whole social good business in a very healthcare context. Right.
Yes.
And in India, we have 3 challenges with healthcare, or opportunities. I don't want to think negatively. I want to think positively. First, the biggest challenge or biggest opportunity is access. Vast majority of our country doesn't have access to care, and that's an opportunity for AI. Right, and I'll explain why. The second opportunity is around quality of care. Again, that's a big opportunity for AI. The third opportunity is around cost. I need not say how that is an opportunity. When we talk about access and quality, today we have a situation where the allopathic system, as we call it, and the number of doctors and nurses and hospital beds and any ratio that you take that the WHO prescribes as standard ratios are way out of sync for what is normal, right? A good example is we have probably 0.63 hospital beds per 1,000 population at best, which is suboptimal. But that means AI has an opportunity for us to figure out whether we can avoid hospitalization in the first place, whether we can intervene at home, where we can aggressively attack a disease condition before it requires hospitalization. And that is, I think, a big big opportunity for AI. Also, if that happens, then how do you distribute the rest of your resources? Your doctors, your CT scans, your machinery, your nurses can be again regulated based on who needs it and who doesn't. Same goes for quality of care. Yesterday I was on a panel, a FICCI panel, where we talked a lot about R&D. And one of the things that we understood is, despite all the research that is happening, and it's good to see Dr. Manish Gupta talk a lot about research, but vast majority of our disease markers are coming from the West. And it's actually research done by the US, Western Europe, and Japan in particular. And I want to call it out because I don't want to keep hiding that fact. And what we do is a variation of that. Okay, we did this study, so instead of Joe walking in Chicago, it'll be Kishan walking in Bangalore. That's almost the only variation we make, and then we try to extrapolate the results. But with AI, we have the ability to look at disease markers specifically for Indian genotype and phenotype. And that will have a huge impact on the quality of care. A good example was a leading hospital in Bangalore, which conducted a research on diabetes patients and on their own database, right? Because you don't have access to outside your own database right now, the way the laws stand. And they found out that, for say, chronic kidney disease, the stage at which they have to intervene for an Indian genotype and phenotype was at stage 2. For diabetes, but in the Caucasian models and the Western models, they intervene only at stage 3. So there is a big gap between the quality of care delivered here and in the US or Europe or Japan for that matter, and that's not driven by the skill and the will of our doctors and our educational and medical institutions. Is more driven by the quality of research that we are basing our intervention on. So AI has that power to kind of improve our quality of care, not only looking at where to intervene, but also looking at how to intervene. And with models like digital twins, you can extrapolate those models. I don't need to really treat a patient as a guinea pig. I can create multiple models of the patient and just see which intervention works best. So these are, I think, 2 areas. Cost, I don't want to talk much because it's very self-explanatory. Less hospitalization. Largest cause of rural indebtedness, surprisingly, number 1 cause is medical care. Number 2 is daughters' marriage. I think the government is trying to handle daughters' marriage and the government is trying to handle Medicare through Ayushman Bharat. But at the same time, I think from the AI perspective, if we can do 1 and 2, that is improve access, improve quality, we would have tackled cost in a big way and then remove this cause that causes rural indebtedness. So I think that was a lot of stuff that I threw you away, Dr. Sunil, but that is where I think we can do maximum social good, and then it can impact all other industries, right? A healthy workforce can impact so many other industries.
Definitely. So you brought in interesting aspects of access, quality of care, and even digital twin we are talking about. So we'll come back to that in more detail. So let's hear from Pranav as well. Pranav, over to you.
Thank you, Sunil. So as investors, what we look at is the global environment considers social good. I think the strongest consensus today is around the UN Sustainable Development Goals. There are 17 areas where most countries across the world have committed to improving for the sake of their citizens, for the sake of the planet, everything from energy, water, environment to jobs, health, of course, education, and many other things. And as we zoom into India, we're seeing more and more that the Prime Minister has actually set an interesting way for the entire country to think about goal setting. So if we think about the future paradigm for technology, and this country is becoming more and more influenced by technology, as we all know today, if we all assume that the end state is an AI-equipped citizenry, then suddenly working backwards from that future is making all other disciplines a little bit more focused upon working together and meeting those objectives. So a simple example is what Dr. Vikram just mentioned. If we assume that the government is going to have a functional national health stack, for example, suddenly the quality of data we need to collect, which labs need to be equipped, how many BSL safety level 4 labs we need across the country, how we sample our citizens, where that data is hosted. Okay, now we need data localization. Now we need to incentivize data centers in the country. So as you can see, a simple example of a future enabled by AI is bringing a lot of discipline into how we set ranges and how different industries work together. A similar kind of objective setting is now happening in education with the national education policy. It's happening in startups in general. More and more infrastructure is being built to support local data at scale. So we think that the AI for social good is a very future-oriented paradigm that is giving a lot of disciplines in India, especially this way of setting clear, very motivated end objective. So we're very excited. We think India is certainly one of the largest theaters for the creation of looking at mind-breaking innovation every day. So we're very excited about what's to come in the future.
Interesting. So I can start with you itself in the next level. So what are the challenges and opportunities you are seeing in this space? Because especially as a venture capitalist, so what are the things which you are seeing from your side, maybe in India or even at a global level?
I'll focus on India, Sunil, because I think the context is more important for us. I think India historically has had 4 disadvantages for most of these large global paradigms. So I'll talk about 2 of those disadvantages first, and then 2 more specifically about AI for social good. I think the first unfortunate disadvantage we have is we do not have as much top-down investment in the country as a country of our size, 1.4 billion people, deserves in 2020 and as we go into the future. So, for example, the 2 largest economies in the world, China and the US, they have become so large, they've become so technologically advanced because the government, top-down, takes a 50-year view and invests billions and billions of dollars to create technology, to incentivize IP, to incentivize research, to incentivize manufacturing, all of this in a local level. And they take a 50-year view. That has not yet happened in India. In fact, I think the last time we heard about such a long-term view was when the Prime Minister announced, the 10,000 crores funding for these VC fund of funds. So we have a long way to go from a capital standpoint. Of course, India is catching up. Private capital is coming in and trying to do a lot of these things for the country. But we think that's one big piece missing. And if we're able to make that happen, I think there'll be magic in the country. The second more interesting thing when it comes to AI is we still don't have a conducive environment for intellectual property development. Our best researchers, our best talent, there is still a massive brain drain from India outwards. Of course, Trump canceling H-1B, so on and so forth. These micro movements might change things from year on year. But the global trend, the macro trend over decades is very clear. We are losing our best people every year. And of course, that's not discounting all of us who have stayed back in the country or come back. But at a macro level, we have to be objective and see that net every year. So we need to be very cognizant about the fact that as a country, we need to incentivize our best people staying here. We need to incentivize people who have come back, who are staying here, all of us here today. We need to have an environment conducive for IP development. We need to make it easier for patents to file. Of course, that's happening slowly. But we also need to make it easier for research to get funded, which ties up to my first point. So I think those are the 2 more macro weaknesses I've observed for India entering a paradigm of the future where we're building AI for social good. Now, when it comes to AI, we have 2 standard problems. Most of the rest of the world is grappling with: talent and data. I think enough of our panelists have spoken about this already. I'm sure we'll go into these 2 problems. But those are the 4 top challenges I'm seeing. If you want me to continue on opportunities, I can, Sunil, or maybe I can do that.
Yeah, you can continue. Okay. No problem.
So from opportunities, Sunil, I think out again, and if I'm objective, forget I'm Indian, forget Bangalorean, whatever it is, forget my identity for a moment. I think India is this magical intersection of large problems, large population, lot of money to be made in the middle because of all the slack. And of course, now it's the 3rd largest startup ecosystem in the world, only behind the US and China. Capital is coming in steadily every year, like I mentioned before. So theater for all of this AI to be developed with very clear objectives to solve real world problems. Now, if you look at many of the AI developments in China, for example, it's to make it easier to entertain people. It's to make it easier to do gaming. It's to make it easier to spend money, to payments, fraud detection. A lot of it is on slightly deviant applications, if you will, not really for social good. If you look at America today, most of the large problems are solved or getting solved in interesting new ways. And there's only incremental development, as you can see there, advanced super economy, as we all know. So really the scope for step function change when it comes to using AI to get to these large objectives. I think India is the only scale country that offers those opportunities. So really from a opportunity standpoint, I don't think there's a better country to be building AI for right now. However, again, we have those top 4 challenges. Those will always be hurdles along the way.
Interesting, Pranav. Because and that too, the unity in diversity as well. Because maybe in compared to the other countries, maybe to reach to the mass people, the same as you mentioned, data and this one and that too, you may need to take care of even the multicultural aspects and even the lingual aspects. But maybe we can do some transfer learning in terms of technology. But I'm sure with the good funding coming in, or maybe it may be taking the baby steps from the government side. But I'm sure we have interesting problems to solve. I agree with you on that. So Vikram, when I come back to you, you already touched upon in the initial, when I talked about on top of the mind, you talked about challenges and opportunities. If you double click on that further, so what kind of challenges and opportunities we can focus further to reach this AI for social good and to the masses?
Yeah, so I don't see we have challenges, because in all parameters we are so rock bottom that there is only one way, that is up. Right? So I only see opportunities. And,
interesting.
And if people are listening to this is the right time to get into healthcare, because one is, I saw some questions from Krishna as well, that COVID-19 has really exposed the lack of our healthcare infrastructure. And but for the very critical decisions taken by the government at that stage, we were not even having basic masks, right? So if you look at the opportunity today, the opportunity is, number one, probably India is the first country to come up with a national digital health policy by itself, right? And I believe that it is going to see light of day by January, which is very fascinating. Right now, it has been opened up to a few select hospitals for some kind of an alpha or beta testing, however you want to call it. And that is creating a paradigm by which the entire framework, including health stack, and how data standards should be identified, how the EHR program will go forward, are being sorted out. So I think that is a big opportunity for everybody. Today we have technology, but it's in silos, right? And that silos is not, we are not able to scale it because we don't have standards. And one hospital data doesn't talk to another hospital's data. Another one device's data. I mean, you work at Philips, so you know what I'm talking about. Your devices will not talk to your competitors' devices, and at the end of the day, 70% of our data is locked up in devices. So the standard identification of a common standard and the ability of every organization to use that standard would have only come from one entity, and that was the government of India. And I think the Prime Minister has done the right thing by taking this head on. I think a lot of foundational work was done in the early years. He got a lot of the data that he wanted, even from programs like Ayushman Bharat, which has led us to this moment where the National Digital Health Policy has been created, which is soon going to be followed up by the Data Privacy Law, which should have passed this time, but unfortunately has gone to the next session of Parliament thanks to COVID, and also with the Disha Act, which is on information security for healthcare. So almost the government is synchronously building this out so that your standards, your stack, your data standards, your security and your privacy are being handled in a symmetrical way. The only other place where this is happening is California. So you have to really appreciate an entire country of 1.3 billion is moving to where one state in the US is moving, right? And California, Silicon Valley, I don't want to talk how much of expertise and data they have. Number two, I think the second opportunity, and I'm not trying to demean the healthcare industry, being a doctor, having worked in some of the brightest institutions, I still wear my Manipal t-shirt with a lot of pride. But the thing is, the future belongs to organizations that have data and can harness that data. It does not belong to organizations that have traditionally been providing care. And let me explain that, right? I'll give you a very simple example, and I've not been authorized or paid by any organization to say this. But when post-COVID, before COVID, I identified a few organizations that have a lot of your data. One of them was CureFit, right? Or Cult, that is common. They have your workout data. They had a lot of data on your sessions that you were having, what you were eating, because they had started this home delivery system. I thought that the amount of data they had on you, and the fact that they could collaborate with other healthcare systems, which they have done through the Swasthya initiative, that would create a paradigm where we would know a lot about insights that can drive healthy choices, right? And this second opportunity does not require you to spend capex. And if Pranav will appreciate what I'm saying, it does not require you to spend capex of 1 crore per bed, as has been the case so far in India. That means I can use my data and use your infrastructure, which is where you're living, to come and intervene and give you, give the health intervention, right? So that means, in a way, I have taken the equation from a capex model where I have to set up a hospital, have to have 100 beds, multi-speciality, hire doctors, nurses, staff, and everything to run it, to a model where by leveraging your data, I can give you insights that you can use to make sure that you are healthy. The third opportunity which comes up, which is directly correlated to an innovation that happened in another field, which is telecom. And I know at 5G is not taking off in India, but it will. It's just a matter of time. The telecommunication revolution, no matter how much we blame it, has today created an opportunity for us to remove the equation on access. Right? If you look at any far-flung area in India, either through BSNL or through Jio, which are the two primary providers that are available in rural areas, and also with the incumbent providers like Airtel, all of them are connected. That means it gives me an opportunity to put these models, an AI model may be available on a smartphone that can do things like quick diagnosis, quick check, get me the health parameters, understand whether the person needs hospitalization. These three opportunities are massive. The ability to have a common standard framework, I think we've struggled with it for a very long time. NHS struggles with it even today, right? Number two, the ability to use data and use insights. And that means I don't need to run a hospital to do that. I can tie up with a hospital, but I can do that analytics for a hospital. Right? Number three, the ability to use smartphones to increase my access to care. I will not have a EMR, I will not have a EHR, but I do have a smartphone. Right? Today, the biggest change that is happening is a lot of the ASHA and Anganwadi workers are getting trained on using the smartphones to do their check-ins, to put in the data that they require, the forms that they fill, their form, E-form, N-form, etc. are being done on the smartphone. Even our integrated disease surveillance program has an ability to integrate smartphones with it, but it hasn't worked as synchronously as it could. So these are three big opportunities. And that means these are three big opportunities that require little or no medical knowledge. Right? The medical knowledge already exists with the professionals who serve the healthcare industry. But as technologists, do have the ability to leverage these three and create a paradigm that has never existed before. A healthcare model that covers 1.3 billion people. Apart from China, nobody has that opportunity. And I don't want to talk about China because we know very little about it. But we have that opportunity today.
Right? Definitely. I agree with you, Vikram. Even the smartphone and even the call data you were talking about, because it's not just one. Because we work together in the Philips, we know the challenges of interoperability as well. So I completely agree on that. And I'm sure even the organization like IEEE and other standard organizations also can take part in helping this standardization coming together and then really reaching the AI to the mass, or democratization of AI we talk about. And when you mentioned the smartphone aspect as well, now we reached to a stage even the deep learning inferences kind of a models we can run even on the smartphone. So that definitely will take us to a long way. So let me hear from Ankush. So you touched upon some of the aspects of from your chatbot aspects and how much of humanness we can bring in that. So what are the opportunities which you see in that angle?
Sure. If I just quickly talk about the opportunity, right, everyone is talking about. If you see the current industry report is saying the market of the conversational AI. See, I again would be biased towards the conversational AI and the virtual assistants and the chatbot. Yes. So the current market is around $4.8 billion, and that is expected to be around $13.9 billion by 2025. Right, huge opportunity. But again, now to answer your part, how humanness and human touch we can add. So, see, one is of course voice, which many companies are doing. Right, Alexa is very successful, and you see Siri and Google Assistant adoption increasing. So that shows a clear sign of adoption of voice. See, we have voice in most of our assistants. So now we have around 265 million users using our chatbots. So we see less than 10% of voice usage, but that is increasing. So, so I think now the trend is towards voice. Now we started adding video to it. As I said, people don't want to talk to the bots. Now we have face to it. Say we recently created a doctor video bot that was world's first AI doctor. So now we collaborated with Microsoft and we are selling across the globe. So that is a real doctor. So we created a bot out of a real doctor. It's doctors' own expertise. See, doctors know most of the fields. If you see the questions or the issues which people ask or have are 70% are repeat, right? Even if you go to doctors, I'm sure Vikram would agree. So when these patients go to a particular specialist, a doctor, so 70% of the which can very well be automated, right? Which can very well be adopted in the bot. So we collaborated with a doctor from Fortis, and whatever his learnings were, we created a bot out of it. And now we see we are getting around 95% accuracy from that. So people who are asking questions about COVID are answered automatically, but and the doctor is giving it, right? So people think it's a live doctor, and trust me, many people are asking, is he live? So it's actually not live. It's not much of a technology, right? It's just a tweak in the use case. It's a tweak in the existing technology which we already had. Instead of showing response as text or showing response as a voice, showing response as a video. Right. So now, if I talk further on my previous point of reaching to the next 500 million users in India, right, it can happen. Technology is there, right? So there's no dearth of technologies here. But I think now, if we bring the mass, right, so all the people in India in this context and experts, right? So if all experts come forward, whether it's medical field, doctors or lawyers or teachers. Now I'm deviating from my point. See the teachers, right? The people who taught us, say, chemistry in say 10th class or 11th class. Year after, and he would be saying the same, right? I don't think even he changes 5% in his teaching style. Right, he might just be adding few questions or few scenarios. He's teaching the same thing again and again, so which can very well be created in the bot. So I'm not discounting the need of the real doctor or real teacher, because right, people can get into different questions or different scenarios. Only doctor himself or the teacher himself would be answering that scenario. But to save the time of the teacher, to save the time of a doctor. So now we're working with around 50 gynecologists in India. All of them are saying, right, so these are the questions which most of the pregnant women ask, and which actually does not need gynecology's expertise, right? To the extent, right, what they should be eating, what exercise they should do. So that can very well be given by the bot. Now you see why women at that critical stage would take a risk of asking this question from a bot. No one would, right? Now you see, they trust a doctor, right? And in India, again, people do not go to probably a branded hospital for the brand. They again check which doctor is where and they go to. So now if we create a bot with the help of the same doctor, right, those patients would trust, and they ask the question, and the bot of that doctor answers.
Agree.
With that, we will get, again, a lot of data, a lot of expertise of those doctors into the bot, and the reach would increase, right? The people say I'm from, say, Jammu, so the people in Jammu, for even small treatment, they come to, say, Delhi, or they come to the other area, even to just take consultation, right? Even doctors do not come on phone for the consultation, right? And with the bots, people in the remotest area can also reach out to the experts.
Agreed. So the communication technology and even the AI personalization with the bots is a long way to go in that. So I do have a question from my side, but before that, let me take a question from the audience. So Krishna is raising an interesting point. So we are in the COVID situation, even some way, the Ankush, what you are talking about, it may take long years for our kids or even for us to adapt to the technology, but thanks to the COVID, or maybe we are able to depend mostly on the online systems, even whether it is an online classes or the telemedicine, it tremendously increased the need for it, right? Because of the present situation. So, but there are some, the other angle, if you see that when it comes to the COVID-19, AI really could have done much more better. The common man perspective, right? We are talking about a lot of technology and all, but still it is done really, AI has done really great in the COVID-19 situation, but we are not reaching the expectations of the common man. So what are your thoughts? So anybody can chip in, maybe Ankush, if you want to start with.
Sunil, can I take that?
Yeah, please, Vikram, you can start with. Yeah.
I have a big problem with people bringing up COVID-19 and blaming the entire healthcare fraternity, government of India, everybody else for it. Okay? So a lot of the AI work that was done on COVID-19 was based on the R0, right? Which is the statistical model of how many people can get infected, and what is the rate of progression of infection. And it's based off the sisters of COVID-19, the novel coronavirus, including SARS and MERS, and all the sisters of this virus and this virus family causing those conditions. So here's the challenge, right? When you particularly talk about AI, it means it's artificial intelligence. And artificial intelligence comes from learning. The learning comes from data. How can you combat something for which we have no recorded data? Right?
Agree.
A better question would have been that we have so much data on dengue and malaria. What are we doing about it? That would have taken on my chin, because that is something we could have handled. We've had cases of dengue and chikungunya and malaria forever. We still don't have a vaccine, and we still don't have a very good predictive model. So through the integrated disease surveillance program, government tracks it for 9 states. But there was a better job that could have been done on it, right? But as far as COVID-19 is concerned, it is an unknown unknown. Right? We don't know the virus. We don't know the impact it's causing. Number two, even the treatment modalities. The vaccine is prevention. Treatment is your standard operating procedure. How do you treat? Like if I know that you have malaria, I have a standard operating procedure. None of those are ever documented or written down for COVID-19, because till 31st of October, it never infected a human. 31st of October 2019 is when it first infected a human. At least that's what we believe happened. Now, when there is no standard operating procedure, that means people are treating with whatever they feel will act against it based on a similar virus or a similar condition that they have treated in the past. But it's not the actual treatment modality for COVID. That means it's a possibility a lot of the data we are generating today is also junk. That means AI is further away.
But I have a different perspective, Vikram. So I agree with you. It is an unknown. But when vaccine, which is very powerful, will it come or not? Time should decide. But my personal view.
Let us talk about the vaccine. So that's a positive thing, right?
Yes.
So according to WHO, this is not me. This is WHO saying that we have 100 vaccine candidates globally.
Yeah.
Okay. In various stages of trial, out of it, 31 should see light of day. This is WHO saying, not me.
Correct.
What is the earliest we produced a vaccine in the past? We took 4 years to produce.
Couple of years, yeah. Yes, easily 4 or 5 years.
I'll give you the exact statistic. It is it took 4 years to produce the mumps vaccine, 1963 to 1967. It happened in the US, right? That was the fastest we came to the vaccine. Ebola took us 5 years. If you're telling me that today we're going to produce a vaccine within a year and a half of first coming in contact with the disease, I think AI takes a big credit for it. Because
I agree.
Look at the vaccine development progress, and you are very familiar with clinical trials yourself, Sunil.
Yeah.
It is a long process, and vaccines are tricky business, because you can have mRNA, you can have recombinant technique, you have live attenuated vaccine and dead attenuated vaccine. Combination of all four, using AI, they have crashed the preclinical phase tremendously. All the R&D phase, the preclinical, even a lot of the trials have been simulated now to bring us to this level where we can start stage 3 trials within 8 to 9 months of us coming in contact. So I think the AI has not failed us. The AI might have saved us, right? But the word of caution here is the data, the SOPs from hospitals. I will treat that SOPs with a pinch of salt. And if I train the AI on that, I might make further mistakes, because this is not the right SOP. I've seen patients coming out, they have brain fog, they have immense, upper respiratory tract damage, which is undocumented now. because right now we're trying to save him from COVID. We're not bothered about his lungs or how his brain is reacting to the tons of antibiotics we have dosed him with and antiviral drugs. So anyway, I appreciate this question. Vaccine part, AI has helped us. Clinical, it could not because we don't have data.
We don't have data. I agree.
Sunil, if I may add something, Sunil.
Yes, please.
I just want to say that I think since all of us are on an IEEE panel, we're reasonably familiar with complexity. Just the human body, just one organ is a complex dynamical system. You take the entire body, its complexity goes up in degrees of magnitude. You take an entire society of many complex dynamical systems in interaction, it's even worse. I mean, the sheer scale of how much dynamics there is in a complicated environment like what the pandemic is causing today, I don't think it's realistic to expect that AI will work for everything. However, I think we're getting so for example, just on testing a specific response to a specific vaccine candidate, that's where AI is helping us run multiple simulations in the same time period. I think that's where we will see incremental change. I think it's unreasonable to expect AI will just change everything magically. So it will take some time. We're a long way off.
Yeah. So because we are almost towards the closing of this particular session, so let me hear maybe 30 seconds each from each of you. Then after that, I'll take a privilege to summarize some of the points. So even while talking to you, I lost the track of the time. So when I am surprised already the 40 minutes passed away. So let's start with you, Ankush. Any closing comments you want to give from your side?
Yeah, so I would touch upon the previous one, as I said, so reach. So I would not agree, right? So it's already reaching millions, right? Alexa already has 100 million users. We have 250 million users, right? So that's kind of half of the internet population in India. So when I'm talking about 250 million, they are Indian users. So
interesting.
If we provide the technology which they can use, right? So India is not only speaking English. So again, I'm talking about the virtual assistant context. If we provide, say, we launched Kannada in KSRTC. Right? So I think that probably would be we were the probably first one giving to any B2C virtual assistant Kannada. So we are providing English in IRCTC. So people used to call center to get the refund status. So now 50% of the queries which you are getting are about refund. So you see the conversation, what they're doing. It's so difficult even for a real human to understand. But our bot understands the way they are asking, mera refund status batao. They can even speak in everything in one sentence or whatever. So we are still able to help them. So if we provide multilingual, vernacular, voice, and omni-channel, right? So let not user come to our platform. Let user be in their platform. They are comfortable with WhatsApp, that's fine. They are comfortable with SMS, that's fine. So let's take our product to them instead of they coming to us.
Yeah. Interesting. So any other closing comments from your side, Vikram?
Yeah, I think I've said enough. But most importantly, I think we have to really work with the government to ensure that these standards are established. I think that is step number one. No matter what we do in isolation, it will be like hunting an elephant with a water pistol, right? It will not work. The ecosystem is big. The industry is big enough. This is a massive human problem, an opportunity as well. So the objective should be to work together as technologists, as doctors, as device manufacturers, as venture capitalists, work together, build the ecosystem, work with the government, make sure the standards come out, the data standards as well as the India stack. I think that will trigger an AI revolution in India, especially for healthcare like never before. And I believe health is a foundational aspect of a person's life, whether it's UN Sustainable Goals or the Alma Mater Declaration, where a lot of organizations, a lot of countries took that declaration. I think if we work together in ensuring these AI standards are created, data standards are created, I think AI is the way to go for healthcare and for social.
Agreed. Completely agree with you. So Pranav, any other closing comments? Maybe 30 seconds from your side.
Yeah, again, thanks, Sunil. I think it was very interesting to see different viewpoints. I would say we're very excited about AI's ability to help restrict and bring discipline to how different entities approach problem solving. we certainly think there's going to be a race now for which country gets to have an advantage globally. We hope India, we see India as a large opportunity. We hope India will compete, certainly be in the top 5. So I think for all of us at IEEE, going forward is certainly an area to watch.
Definitely. Thanks a lot, all the panelists. So let me just take 30 seconds to summarize my point before I hand over to the next panel. So the key takeaways, what I've taken from this particular session, different viewpoints from a doctor and a venture capitalist and a startup CEO. So we need to get the experts, and that too giving out the knowledge from that personalized experts will definitely help the people to embrace is one point. And second thing, we try to highlight the support from government or even the venture capitalists, and that to standard, we try to give the emphasis for the standardization and identifying the right use cases. And because the data enablement and then building the model, the technology is there, as we agree. And I'm sure we are going to the next level of usage of AI to solve the real world problems. And that's where democratization of AI will happen, and looking forward for that. Thanks a lot for all your contributions. So this is our virtual flake for each of you. On behalf of IEEE, let me thank all of you, Pranav, Ankush, and Vikram, for your valuable insights. Thank you. So that brings to the next panel discussion. So I'll take the opportunity to introduce Dr. Dijon, who is a distinguished technologist from HP, and then he's a fellow of IEEE. So let me hand over the session to him for the next interesting panel discussion on AI for social good. Let me stop presenting, Dijon.
Thank you very much, Sunil. Let me share some slides. I have great honor and pleasure to have an exceptional set of panelists who will be doing most of the work, by the way. We have Alexandra Posoldova from Australia. We have Janice Dankas from California, and Tom Coughlin, also from California. Let me start sharing the slides. Can you see the slides?
Yes,
okay.
We can see.
Excellent. Yeah. Thank you. So with this, because we don't have too much time, I would just like to start the work. So Alexandra, would you please take over? Alexandra Posoldova is the senior data scientist at Black Book AI, and she's also IEEE Queensland section chair next year. And then I will introduce the other speakers as it's their turn. Alexandra, it's all yours.
Thank you. Thank you for a kind introduction. Welcome, everyone. Good afternoon, morning, or wherever you're connecting from. I believe there are people connecting from all around the world, myself from Australia, and it's afternoon here. So today I have the pleasure to give you a brief introduction overview of AI for social good. And so let's start with applications. And really with AI, the only limitation to what AI can be applied to is the technology we have available and the research. Some examples of application or groups of applications is, one is informed decisions, where AI is able to go through large amounts of data, find patterns, and helps us drive insights into data and makes better decisions based on the data provided. We can find relevant information much quicker with advanced information search engines. And one of the very important aspects or application of AI is work safety. And so as one example is robots, and we've seen Boston Dynamics making great advancements in developing robots and how they become more resilient, and we can send these robots to places where it's dangerous for humans to go and work there. Another example would be sensors. I previously worked for a company that developed sensors to monitor machine health. So this replaced people having to go to these places, inspecting machines on a regular basis, often to places that are dangerous to go to because it's all heavy industrial machinery. So instead, using sensors, we can track the machine health and only send technician when it's absolutely necessary. So this improves health and safety on workplace. Another application is to use AI for insights and use augmented decision making. So having a person looking at AI recommendations or predictions and making decisions based on that. One step forward would be fully automated AI-driven decision making. And I've seen only very few applications of it. I think it's because we don't trust AI as much to make to action on its decisions, and we would like a human to review or make sure this decision makes sense. But this is definitely a direction we're moving towards. Next slide, please. To make sure that AI serves us and not the other way around, or it doesn't become a double-edged sword, I found a list of AI ethics. This I didn't come up with it. This is a list from from Australian government, and I think it sums up really well. It provides kind of guiding lines to AI development. So I'll go through this list and provide my own opinion and experience. So first one is human, social, and environmental well-being. Throughout their life cycle, AI systems should benefit individuals, society, and the environment. So this is important to keep in mind when developing AI. What's the purpose of it? Now, for example, if there is an oil mining company and develops AI to drive profits and make the oil mining efficient, this can quickly become very harmful to the environment. Another example would be social media. The AI recommendation engines of social media are quite advanced, and we often see feeds or posts that are relevant to us, and the more we use it, the better it gets with its recommendation. But does it really serve us, or does it serve the company that drives profits from us being glued to the application? And the more attention we give to the social media, the more beneficial it is for the company and not ourselves. Next one is human-centered values. Throughout their life cycle, AI systems should respect human rights, diversity, and autonomy of individuals. And I combine it with the next one, fairness. Throughout their life cycle, AI systems should be inclusive and accessible and should not involve or result in unfair discrimination against individuals, communities, or groups. Now, AI can become biased and can become racist. And this is not because the way AI is designed, but because of the data that is available to train AI models. For example, there is AI model that recommends people that are eligible for CTO role in Europe. The majority of applications would be, let's say, males who have who graduated from university and they are Caucasian. Now, if there are other applicants from other ethnic groups, they would probably be disregarded, not because they are not good, but because AI haven't seen enough examples of these people applying and being successful in the application process. And what we can do about it is to account for imbalances in data and using undersampling or oversampling methods. Next one is privacy protection and security. Throughout their life cycle, AI systems should respect and uphold privacy rights and data protection and ensure the security of data. Now, we've seen many times large companies, especially social media companies, breaching this and selling user data. We need to make sure we have data privacy policies in place that are the same across nations, because the data really floats across countries, but the countries are not unified on how this should be handled. Reliability and safety. Throughout the lifecycle, AI systems should reliably operate in accordance with their intended purpose. What can happen is that models that were trained on certain sets of data become useless over time because the data changes. And we've seen this quite recently when COVID hit us. I can imagine it threw off a lot of trained AI models. What we can do is to monitor for data drift. This means comparing the latest observed data to the data the model was trained on. And if data drift is detected, meaning that these two data sets are statistically different, AI is automatically retrained to make sure the predictions are still valuable and current. Transparency and explainability. There should be transparency and responsible disclosure to ensure people know when they are being significantly impacted by an AI system and can find out when an AI system is engaging with them. As an example, there are many chatbots, and it's only until you start typing a question and receive the first answer you find out that you're talking to bot and not a person. This should be clearly stated who you're talking to. Another example of transparency is more on ability to explain how AI model arrived to the decision. Especially with more recent models that are based on neural networks, and as the models become more complex, it is more difficult to reverse engineer the decision making of the model. And we do want to have this transparency on how the AI system arrived to decision. There can be another layer of abstraction or another system on top of already trained AI model that is feature-based model providing or understanding the relationship between input features and AI decision-making, helping us understand what features impacted the outcome. Contestability. When an AI system significantly impacts a person, community, group, or environment, there should be a timely process to allow people to change the use or output of the AI system. And this comes to, as I mentioned, the fully automated AI decision-making. When are we comfortable for AI to make this decision, and when a human should step in to review whether this decision makes sense? We need to have a set of rules or conditions in place for this to happen. And I will talk about technology that can enable this next slide. A last one, accountability. Sorry, there was one more. Accountability. Those responsible for the different phases of AI system lifecycle should be identifiable and accountable for the outcomes of the AI systems, and human oversight of AI systems should be enabled. A great example of this is self-driving autonomous cars. If this car happens to be involved in an accident, who's responsible? Is it the driver? Is it the company that made the car, or is it the company who developed the AI system? In my opinion, it should be the company who created it, who made the car, and the company who made the AI system, and these companies can be insured against potential wrong decisions. Next one, please. And the technologies that enable enable AI, advanced AI, and can help us keeping this guarding rails for AI. The first that comes to my mind is computational power. With enhancements, distributed computing and quantum computing, the amount of information that systems can go through is large, and this will only be increasing. Huge enable or technology that I see working really well with AI is blockchain. And the main aspects is data governance. So how the data is written and stored, because in blockchain, nothing gets overwritten. It only stores the next iteration of the data. This is very good for reproducibility of the results and backtracking of the results. So when AI made the decision, what was the data at the time, what happened to the data, and we can better understand what happened at the time. Identity management. I think cloud providers do a really good job in their IAM roles, so providing policies to group of people or individuals, and depending on these policies, how people can interact with the system or the data. Blockchain can offer another layer of abstraction to it, where each of us can have its own identity, where we own the data as individuals, and they can be everything from passports, ID, from driver's license, medical history. And we identify against the system that exchange a handshake and agrees that this person is safe, they agree. And based on that, knows what are the person policies, set of policies, how the person can interact with the system and the data. And the last one of blockchain is smart contracts. To make AI being able to do fully automated decisions, we can use smart contracts to determine when we can rely or trust AI to do this decision and when a human should be involved. Next enable, as I mentioned, is cloud. The three major ones that I worked with is Databricks, AWS, SageMaker, and Azure ML. They make it really easy for people on different from different backgrounds, data scientists, machine learning engineers, and data engineers to come together and collaborate in one platform. And very important is cybersecurity. So once we start relying on AI and this all interconnected sensors and systems, we need to make sure that they can't be exploited. So if we sit in a self-driving car that is fully connected to internet and relies on internet for its downloads, we need to be sure that no one is able to take over the car and drive it off the cliff, for example. And this is all from my presentation. I might hand it over to the next panelist. Thank you.
Thank you very much, Alexandra. Can we please try to stay within 10 minutes, if possible at all? We started 5 minutes later and we burned a little bit more. It's my pleasure again to introduce Janice Dankas, who is VP of Innovation for Social Impact in the Office of CTO of Hewlett Packard Enterprise. Janice, it's your turn. Janice, you're muted.
Great. All right. Thank you. So what I'd like to do is to use this opportunity to kind of build off of what you've just heard and share some context about the creation of a social impact program that leverages our technology understanding of artificial intelligence and machine learning, and give you some examples and use cases of programs that are benefiting and impacting society because of our knowledge of AI. So next slide, Dion. So the context here, first of all, is that there's a lot changing right now in our world. There are global megatrends that are shaping our world and our futures in really profound ways that are impacting all of us, all enterprises, and all shapes and sizes. And although these megatrends provide a lot of risk for all of us, there's also opportunity to make change. And as a global community of engineers, like IEEE is, it really is our responsibility to anticipate these changes and apply our abilities and innovation to really help stay ahead, seize the opportunity, and create a more sustainable future. And the need to take urgent action on social and environmental issues and to apply technology to tackle these great humanitarian challenges really hasn't been more important than the current global crisis that we're all in together. The unprecedented impact of COVID-19 on really all aspects of society reminds us that it's not business as usual, and approaching it as business as usual is not an option in tackling either the pandemic nor its consequences, nor the environmental or social challenges long term. So how do you begin? If you go to the next slide, I'll share with you how we at HPE have selected projects and chosen where to focus. And the social impact work we're doing is really, it's not a business development, it's not a sales effort that we have underway. It's truly a way to demonstrate our company mission, which is to advance the way people live and work. And so in looking at how to start the challenge, as we enter the decade of action towards the United Nations Sustainable Development Goals, the need for transformative change is really urgent. And the UN has challenged us to find and make transformative progress, from 2020 to 2030. So what we've tried to do is select the SDGs that we feel that we have a material driven approach that we can actually apply to some of the goals. Obviously, we can't tackle them all. And so therefore we have selected and chosen 6 SDGs in particular that align to our strengths, and then went ahead to choose and select projects where we think we can create what I like to call a through line of projects through partnerships, through employee skills-based volunteering, and through technology contribution that can truly demonstrate measurable impact in these areas. And so the SDGs we've selected include SDG 9, which is the combination of industry with innovation and infrastructure, where we apply kind of our innovation engine across solutions and working with partners try to address these complex challenges. And we've also selected SDG 17, which is partnership to goals, to be an underlying theme across all of these so that we could work purposefully and collaboratively with partners and clients and the NGOs and governments to actually have impact. So from finance to farming, medicine to manufacturing, a focus on the edge to the cloud, artificial intelligence, supercomputing capabilities, all of these are solutions that we think the timing is right now for accelerating the sustainability of entire industries and for creating a more sustainable world. So I'd like to share with you, I think I brought out 4 use cases here, and I'd like to start first of all with the first one, which is on agriculture. So SDG 2 is around agriculture and food systems, which arguably you could say that the agriculture industry is probably the last industry to be disrupted with technology and the most in need of assistance in analyzing very, very complex data that is emerging. So when you try to look at the complex food system, the food ecosystem, from climate, soil, plant phenotyping, food deserts, the supply chain for food, and how food is sold and bartered and exchanged across the world, it is an immense amount of data. And in our partnership in working with the World Economic Forum, we've identified many, many opportunities where providing data analytics and artificial intelligence could contribute. So as a few examples I've listed here, and actually through work that we've conducted with Purdue University in the US, who happens to be both an engineering and an agricultural studies leader, we've identified areas around understanding and identifying hunger crisis intelligence and mapping where hunger issues exist and what relief measures could be applied and anticipated. We've been working very closely by applying a data analytics ecosystem to bringing together the intersectionality of climate with crop biodiversity and phenomics, which is intense amounts of data. And then working with an NGO actually here in India called Digital Green. And Digital Green has kind of the link into the last mile, I'll say, a connection into smallholder farmers, both in India and in Africa, where they are working to take artificial intelligence around the many aspects of agricultural metadata and then making recommendations and delivering that to farmers to improve yield results. And of course, I think our last speaker talked about blockchain. Blockchain is certainly a contributing technology to improve supply chain efficiencies in agriculture, and then understanding the exchange of data, protecting data ownership on the behalf of the farmer, and ensuring that data information is shared around insurance and lenders so that food can move more efficiently through the marketplace. This is another application. These are very, very large areas, and there's lots of effort to be made here, and certainly lots of opportunity to contribute there. Next slide. So the second area I'd like to share a little bit with you about is around education. And in this case, I'd like to speak to you about a program we've funded and provided thought leadership around called Curated Pathways. Curated Pathways is an online personalized learning application that is applied to students to help understand how we can engage more females and underrepresented minorities to study and sustain their interest in STEM, science, technology, engineering, and math. And at least in the US, it is a huge, huge problem. We are grossly underrepresented by gender and ethnicity in these fields, and certainly in some areas around the world as well. And so what we've tried to do is understand how content the student studies can be engaging and which content can actually be responsive, culturally responsive to ethnical influences. And so we are using recommendation algorithms to help study and understand students' engagement with content, to understand what causes them to be interested and what types of learning methods and approaches and sequences of learning technical content causes them to sustain and persist in studying the field. It's been a fascinating set of projects that we have underway in the US, and we are in the process of bringing that internationally as well. So that's another example. The next example I want to share with you about is in the area of health. So from a context perspective, I mean, if we had understood a little bit more about the 1918 flu, you would see that certain health policies and health practices, had they been studied at the time, could have had an effect or an approach on how health is managed. And some of that could and should be applied to the COVID-19 outbreak. So that, understanding the data and some of the research findings around hand washing, for example, and sanitization actually has had measurable effects on reducing the spread of illness. And you can see in some charts here how that has actually led to the creation of health ministries around the world over the years. And those ministries have actually continued to study the progression of disease. So if we go to the next slide, what I'd like to share is a little bit around activities for COVID-19. And I don't have the charts listed here from our researcher because they're not publicly shareable at this point, but she used the Bayesian model averaging approach to study and model population, age, and susceptibility for illness in several countries in Europe, and did created some heat maps that actually was able to show where globally aging populations could become more susceptible to the pandemic. And with that information, we have been able to share that with the World Health Organization so that they could better understand where they may want to move and apply access to intensive care units. And where the vulnerability of older demographic groups reside in these countries. So I don't have the heat maps to share with you, but I can use that as an example. And then, actually, this was another one to support the comment that I just made around looking then understanding where the demographic issues are, where you could move logistics as well. Another example in the health space is the work we've been doing with DZNE on understanding dementia and Alzheimer's disease. It's a very, very complicated disease that has many, many influencing factors with huge amounts of data. And DZNE has been working with us to apply pretty high-end computational speed to support their algorithm research. And they've actually been able to go from analytics from like 22 minutes to 13 seconds through the contribution of pretty high-end technologies. And that has led to further advancement of their research. I think you'll read about some of this in the Nature I think they're publishing in Nature magazine next month, where you'll learn more about the findings that this has enabled. And I think I might have one more example after this. Let's see.
No, I think that is all.
That's the last one?
Yeah. Thank you. Right. Thank you very much, Janice.
Sure.
Great insights by both Alexandra and by you. Our next panelist is Tom Coughlin, fellow IEEE, president of Coughlin Associates. And Tom is also past president of IEEE USA.
Thank you, Dehan. So I've got I thought I'd contribute to this panel with a few ideas on the ways that AI can help with social issues. One of them is, and I think it's very timely right now, especially for instance in the US, is can we use artificial intelligence to help determine the veracity of information? There's so many channels out there of information claiming to be true, but sometimes they turn out to be misinformation, misinterpretation, or outright lies. AI, I think, has a potential to be able to help us to look at the veracity of statements and information, maybe doing surveys of information sources of various sorts. And so the question might be, if we're going to do this, what sort of training will such AI require, and how do we curate such data sets? The other thing is there's actual websites and initiatives on the internet which are trying to help people to do fact checking, such as Snopes. Another one is the Internet Court of Lies. So could that also be information that feeds back, or perhaps feeds into an AI system, or perhaps the AI system can feed back into these? And in fact, that gets into a bigger trend, which is that AI should not replace our own knowledge and understanding of things. It should augment it. Next slide, please. Yeah, another one is, okay, do one or the other. There we go. Another one is the use of AI with data from consumer health monitors, like wearable devices, that sort of thing, perhaps to determine the onset of illness or health risks. And to some extent, they do that now. It's one of the reasons why people wear those. I know my mom actually got an Apple Watch so that she could have the fall sensor, if something happened to her. So that provides sensors, alarms, that sort of thing. Was a dangerous situation, but the capabilities are limited. So, and they also have limited accuracy, and that's part of the reason why their costs are low. But it also means that it's also why they're not, registered, certified medical devices. They don't have the accuracy to do that. Can AI be used to improve the accuracy of these measurements, or improve those warnings? Could it take into account important characteristics, potentially even genetics of the individual users that are using it? So, and can this be done in such a way that preserves the privacy of sensitive medical information for the user, so that they control what that data is being used for? And would most consumers use those features if they were available? And I believe it would, but would this help to reduce the costs of medical care? It feeds into some of the things that Janice is bringing up, for example. Let's go to the next slide. Could we use artificial intelligence to help people with disabilities? So there are technologies that use some form of AI for helping users to operate prosthetic devices, other forms of human augmentation. Can these be made better? Can be made more available to people in need? Can we provide ways in which people can get online and interact with other people who might have issues, physical issues that would make it hard for them to do so otherwise? For instance, people with various speech problems, improve their ability to communicate with others. Can an AI be used to help find the right medical treatments for individual patients? Can it be used to help those with various mental disabilities live better lives? I think that's a very important one, because a lot of medical treatments are very long, and they don't always have the best prognoses. Can AI use to help chronically homeless people find and keep a home? Should it be used for those kind of purposes? Can it be used in more ways to help older people remain independent longer? Next slide. Can it help us in our negotiations and conflicts? Could AI be useful helping people deal with conflicts, providing with the best options for resolving conflicts? What data sets can be used to help train such an AI? How would you train such an AI? How long does it take to train it? And could it be made fast enough so it's useful in a dynamic and quickly changing situations? And what kind of computational capabilities do we need to do that? What are potential bias issues need to be addressed for something like this? And what can an AI do versus what a human can and should do in these situations? And since many conflicts involve the use and availability of resources of various sorts, can AI help us to better understand, or even in the case of negotiation and discussion, mutually understand resource allocation issues and possible resolutions of those issues, which could be to the greatest benefit of the parties? Next slide. That may be my last one. Yes, but there is one thing I would like to bring up, and actually it was from the 2017 IEEE Sections Congress, which is in Australia. There was a fellow there named Alan Finkel, who was, at that time at least, chief scientist for the Australian government and an IEEE fellow. And there were three things he pointed out. He was talking about addressing artificial intelligence and what humans can do to prepare for a world where artificial intelligence is everywhere. And there were three key pieces of advice I'll pass on just to finish early and to give Dehan some of his time back. The first one is artificial intelligence should not replace our intelligence. We should be skilling up and becoming better, not becoming dumber because we have artificial intelligence. So we need to learn how to use artificial intelligence to make us smarter. We should also improve, the essence of engineering is people. It's the capacity to design around human limitations so that we as a species can transcend them. Can we improve our own ability and grasp of what people can do, and the relationships between designers and the people that they design for? Can we do better jobs of that? Maybe. And the other one was to embrace and guide thoughtful regulation of AI, getting into the ethical practices of AI application. So with that, I'm going to turn the rest of my time back to Dehan. I hope that helps.
Thank you. Thank you very much. These were all great insights. Let me stop sharing and then see whether there are any questions from audience. Audience, please submit the questions. And in the meanwhile, until we get these questions, let me ask some questions that I prepared. There's a lot of discussion about inclusion and diversity lately, and I'm curious whether the human behavior towards inclusion and diversity also propagates to AI. If we are training AI, we will train it the way we behave. So are there any thoughts about this? So anyone is welcome to start.
There's a practice, and I'm not, there's a practice in AI, I think they call adversarial AI, where you have AIs that they try to fight against each other, or have, doing things against, and they actually do it against each other. They get better in the course of doing that. Could we use that as a way of testing biases? I'm just wondering if there might be some ways in which we could create bias testing solutions using AI itself as part of the means of doing that.
And go ahead.
So I would like to, starting with your idea to use adversarial networks, they compete against each other, but they will be only as good as the data we feed it, in my opinion. So if we feed it data that is usually biased towards one class or one set of samples, then they will eventually converge to this type of decisions. What we can use is, as I mentioned, undersampling and oversampling, but also using reinforcement learning and deep learning to make AI making new decisions, not only going by the decisions that the AI have seen that were successful before, but also developing kind of its own intuition, if you will.
And then just to comment on that, one example of how these AI techniques can address inclusion and diversity issues. In the education example called Curated Pathways that I mentioned, we are explicitly training the algorithm on high minority representation in school districts, as opposed to the typical makeup of schools in the US. And so what we actually discovered through engagement and through the data, which we put human eyes on to make sure, was the bias actually being introduced by teachers. and the bias actually happening in the classroom today around the content that was shared, we discovered was actually particularly engaging white males, but disengaging in statistically significant correlations, all females and all students of color, using very, very popular and well-known math content. And so that was a learning. That was kind of something we discovered through the AI analytics engine.
Okay, I have a question here from Rajeshwari Itaji to all panelists. What progress is there at present to use AI for speech disability, especially tested approaches? It's a very specific question about speech disability. Any thoughts?
I don't have any specific experience with it.
I don't know either, but I know that this area is still developing when it comes to transcribing from speech text. It's developing fast, but still developing. I would say it's about 80% accurate, so it would be even more difficult with doing that with speech disabilities.
Okay, Tom, anything from you?
Well, I can't say, any kind of particular case study, but it seems to me that if you had something that, if we had devices that were training off of the experience and got feedback from an individual, they're using it, they have feedback from the individual, and that's part of their training, that it could, that one of the things it could do if someone who has speech difficulty is to help them, is to improve their means of communicating, interpreting what they're saying, what they're trying to communicate, or depending on what the disability is, trying to compensate for it in some way.
Okay.
Or training, just helping them to train to overcome the disability if that's possible.
Okay. I have another question for you. There's a lot of regulatory compliance, and I think Jenny spoke about it, and also Tom and Alexandra. So we have this contention between individual countries and then global level. But AI really needs to be regulated. If we don't regulate it, then it's going to be really tough. So do you have any thoughts? How can we make a peace between these local and global with respect to AI regulations? Any thoughts by anyone?
I don't have a lot of direct involvement in policy work. We're really focused on the technology, but I can tell you in our involvement with the World Economic Forum, because of their reputation as a convening organization and their deep connections with governments, an organization like the Forum actually excels at brokering those kinds of conversations. And oftentimes it comes down to really demonstrating the impact, the positive impact that AI could have to actually convince local agencies to participate. I think, so that's just one example of bringing in the experts.
So there's, as a past president of IEEE USA, I know there have been some public policy discussions on AI where IEEE USA has participated to try to present understanding. I think one of the tools, if I recall right, there's an activity within the IEEE on ethically aligned design that started out in the Standards Association, which I think tries to address a lot of these issues about, what is the, if you're going to do regulation, it should probably relate to the ethics of the things that are being done and what's right and wrong. And I think there are some tools within the IEEE and which have been used for some public policy discussions on these issues.
Yes, I agree with Tom. I was about to say something similar, that we can use, that's one of the roles of IEEE, to produce standards, and then the standards can define global guidelines or playbook how AI should be designed and developed and used, and that can be then enforced nationally, internationally.
Thank you very much, Alexandra. We started about 5 minutes later, and we are close to 5 minutes late ourselves. I would like to use this opportunity also to express my thanks to the panelists, and as a small token of appreciation, there's a virtual here, and there's even, I'm not sure if you can hear it, but there's applause Virtual applause and virtual for you, Plakes. Thank you very much. Indeed, it was a great honor and pleasure for me to work with you. Audience, these are extremely capable, knowledgeable, and insightful set of individuals. Going backwards this time, Janice, very high-level executive in Hewlett-Packard Enterprise, Alexandra, both extremely successful volunteer in IEEE, and Tom Coughlin, also very highly positioned inside of IEEE. Thank you, everyone, and thank you, Puneet and the rest of the team for organizing this panel.
Thank you, Dehan, for moderating.
Yes,
No
thank you.
Thank you. Have a great rest of the day.
Bye, everybody.
Thank you,
Bye,
everyone.
Thank you all. Thank you very much.
Okay, now back to the agenda. So can I get the permission to be a presenter?
Yes, one second.
No problem. Yes, I am the presenter here. Okay. Sure. Hans, good to see you here after a long time, and let me take the pleasure to introduce you to our attendees today in the conference. It's my great pleasure to introduce Dr. Hans Hafstad, who is a Vice President and Innovative Programming Manager at Philips CTO office. I'm fortunate to work with him during my stint at Philips. So it is actually 6 a.m. You look very fresh, and we are ready to look for your Power Packer presentation. So it's my great pleasure to introduce Dr. Hans. He spent a good amount of time in Philips, and before that he has done his postdoc from Switzerland and PhD from Amsterdam. He has about 200 publications with a H index of 42, and he holds 10 granted US patents, and the more interesting part is more than 80 patent applications covering 25 different patent families. So really excited to hear from you, Hans, and over to you. I'll stop presenting. So even though I have your deck, it may be more comfortable for you to share from your side. We'll make you presenter.
Thank you very much, Dr. Sunil, and I'm very happy to join remotely. However, I am not able to share my content.
One second, we'll make you the presenter. Can we make Hans presenter, please? Yeah. Can you see now the option to present?
I can, and I will. Thank you very much, Sunil.
Thank you. We can see the content. You can proceed, Hans.
Yeah, okay, thank you very much. And again, very happy to share this virtual. I would have preferred to be with you in Bangalore, where we have also a very stimulating and exciting team I'm working with, and I will share some of the information that we are actually creating as we speak on the ground in Bangalore. I will speak about digital health technologies and how they support particularly the access to care. And moving forward, and I hope to be able to do that somehow. I'm not moving. Yeah, there we go. I would like to say that many of the things I'm showing are works in progress. So I'm working in research. So I'm very much sharing also information that that we are working on, but that is not yet commercially available, and I'm also not sharing any commercial information. Very important as a background is that what we try to do within Philips is to address and help to address the global healthcare challenges. 1 out of 3 people hit by cancer during their lifetime. 1 billion people, particularly also in India, that have to address cardiovascular disease, a very debilitating and life-threatening disease. 1 billion on the people on the planet suffering from hypertension, respiratory disease, and diabetes, also impacting people. Now, if we look at the challenges that I would say overall address healthcare, it's about aging, it's about increasing number of chronic diseases. In the meantime, 75% of diseases are chronic, are taking over from infectious disease, although the COVID crisis at the moment, of course, also has a very significant impact, and actually also leads to chronic disease in many cases as well. Pressure on capacity, stress for healthcare workers, cost of healthcare that are exploding, and obviously the access to care for many people across the globe that do not have appropriate access. And there, what we are doing within the Philips Research Organization is to develop solutions that afford personalized health, afford better outcomes, and higher efficiency, which is very dearly needed. So what we are about is really to improve people's health through meaningful innovation, and we have a very strong ambition to improve the lives of about 1/3 of the global population by 2030. And as you can see, we are moving towards that as we speak right now, and we are measuring that, of course, to see how we are doing and whether we are addressing the people that need it. We do that within the framework of the Sustainable Development Goals, and particularly focusing in this talk on the third goal, on good health and well-being, a fundamental right for everyone in the world. And in doing so, of course, we realize we cannot do it alone, and we have to work together, building coalitions to drive change globally. And there, particularly, a sub-aim, another aim is to focus on those people who had a challenge in having appropriate access to care, with a goal to serve 400 people on the globe in underserved communities, which is part of the wider ambition. Now, the way that we are doing this, you can see here, is in 3 ways. First of all, we drive technology, digital-driven innovation, which is really a focus we have, obviously, in Philips Research and on the Philips Innovation Campus in Bangalore. An example is also to provide mobile units, and particularly at the moment addressing the COVID challenge, very important. But of course, also we have to realize it's not only about technological innovation, it's also about bringing innovation to users and customers, and there different approaches are needed to do that. First of all is to address the cost issue, so to develop new business models and ways to make solutions available, but also, as I mentioned before, to build strong partnerships, to realize we cannot do it all alone. We really have to work with an ecosystem of partners to bring the innovation to our customers. As I mentioned, digital being very important. A number of things are helping there. All technologies in the meantime across the healthcare space are becoming very much digital. Imaging, patient monitoring, vital signs monitoring, also bringing care to the home with home monitoring, simple sensors that can be connected to remotely, enable an integral approach to healthcare and reach our patients and customers wherever they are, and to support also healthcare workers wherever they are as well. And at the same time, in order to drive personalization and more precise care, genomics, digital pathology, obviously radiology, imaging, really enable also digital solutions that are becoming more and more precise. And of course, enabled by all these data that are becoming available, we can leverage AI, artificial intelligence, and advanced digital analytics to support our customers and users also wherever they are. And therefore, in digital healthcare solutions, we can support people on the globe with better health and lifestyle solutions, preventive measures to ensure a longer and healthier life, drive precision medicine, providing collaborative and networked care, helping people with peer review, even remotely, improve efficiency, and also provide information to patients and citizens so that they can play a role in their own healthcare provision. And very importantly there, provide and support equitable access to quality care wherever the person and patient and professional may be. And there also very important is to support learning, education, and coaching. And AI, again, plays a very important role to connect all the digital information that is there with applications and supporting better outcomes. And a very important element in this, obviously, is the cloud, which enables sharing of all that information, reaching out to patients across the globe, connecting patients and healthcare professionals wherever they are, and also connecting healthcare professionals, providing advice, services, peer consultation across the globe, and connecting people wherever they may be. And there the focus, of course, is both on the specialist, the healthcare provider, but also on the patient, and to connect it to, which of course is very important. Going forward, what we are also driving at is to use all this information that is available to integrate that and to build all that information into models that, if you like, provide a digital twin of a patient or of an organ, so that we can model what is the outcome of intervention to choose the best intervention, and also in that way provide expert advice and information also remotely. And as a result of that, help in more precise treatment planning, and also to share potential outcomes, risks, and benefits with the patient that in the end needs to choose the treatment that is the best for him or her. After this introduction, I would like to give 3 examples that make the message come to life a little bit. And these examples are examples where we are very much working in our lab in Bangalore, in the Philips Innovation Campus. One focusing on the application of AI in radiology. The second will be addressing needs in maternal care, the mobile obstetric monitoring application. And I will say a few words on the COVID-19 applications we are developing. First of all, use of artificial intelligence in radiology, a really very big opportunity to help radiologists to do a better job, not to replace them, but augment them, enabling them to integrate large amounts of diagnostic data for earlier and more definitive diagnosis. Also being able to reach out to other examples that are similar, helping to prognose outcomes and support the diagnostic process, which of course enables to create a decision that is based on rich information and insight, choosing the right study at the right time, and of course helping to make the right choice with respect to the intervention. Also supporting the therapy itself, image-guided interventions, very precise, and really moving forward with also increased efficiency and optimizing outcome. And again, very important as well is to simplify and support workflow, which of course is important for the efficiency. Interesting example showing here, where we're actually from the Netherlands, we are collaborating with the colleagues in PIC that you see on the slide, with one of our university medical centers. And that is, in many cases, a huge amount of data involved. To move the data around is not very efficient. There's also all kinds of privacy regulations. And the approach that we are using there is really keeping the data on the same place, but then moving the algorithm, moving the model around, and sharing models and algorithms in development of more powerful applications. That, of course, requires that data are fair, are findable, accessible, interoperable, and reusable, really opening up the data and information that is there and that is rich, and doing that wherever the data are and bringing that together. So we're sharing not the data, but the model. And in doing so, we get actually excellent results, as I will show you. We are using that at the moment, for instance, for stroke classification. And you can see on the bottom right the outcome of that with an area under the curve of 0.91, accuracy 0.92. Actually, very good results that enable clinical application. And as you can see here, we can also do the same for liver segmentation, supporting treatment of liver disease, of liver cancer, supporting the image-guided intervention that, of course, makes the treatment much more precise and less harmful for the patient. And in comparing the outcomes that we obtain in the purple blocks, you can see them, that we can obtain in this approach, the distributed learning method. It is at the same level as when we would put these data together in the same place. Really supporting this way of working and enabling making progress, sharing information, and learning wherever the researcher may be. Second example is in the delivery of obstetric care. Of course, a very important application where still a lot of women are dying due to complications, challenges with the newborn that we can provide, and of course also a very important part of the Sustainable Development Goals to address challenges in and around giving birth. The challenges are many. There's the access to care, it's the difficulty to share data, workflows that are not very efficient, and extremely important, the ones on the bottom, and the need for early identification of high-risk pregnancy so that preventive action can be taken. The pregnant lady can be brought to a facility and gets professional care and not getting an emergency. And of course, addressing shortage of doctors and the shortage of midwives. And the solution that we are developing there, the maternal and mobile obstetric monitoring application, really addresses these needs by bringing together the information, leveraging the cloud to share the information, where we address both the caregiver as well as the mother, if you like, the patient, help the midwife also with consultation remotely of a doctor that provide professional advice, and support it with a web portal where all this information is brought together. And so it's a combination of a web portal, a patient and a caregiver app, where we are actually not only addressing the pregnancy and birth, but also the first 1,000 days of the newborns, the baby's life, which of course is important to also address the challenges of newborns that can be supported as well. So very important, of course, is not only to develop solutions, but also to test and verify the outcomes, to really measure whether we make a big impact, a positive impact on healthcare. And here you can see one of the examples where we collaborate with Narayana Health in India to provide the mobile obstetric monitoring approach there, and really to identify I would say the improvement that we are able to bring about by introducing this mobile solution to obstetric applications, where you can see that a significant improvement in early detection of the high-risk pregnancy, and that of course translates into earlier referral and a significant reduction of maternal and infant death. In view of time, I will move forward quickly to the last example, and that of course is a very relevant one at the moment, where we have to address the acute challenges and life-threatening challenges of COVID, really bringing applications to the world that enable helping to address the acute challenges we have over there. One example, use ultrasound, and in the picture that you see the result of the measurement with B-line ultrasound to help the triaging and also support the treatment of patients with COVID. Ultrasound, of course, being a very accessible technology in terms of cost and application, portable as well, so that you can use the technology in a broad way. And also creating a special outreach kit, a portable outreach kit, to go to people's homes and support community healthcare solutions. Also providing information that is needed to provide the triaging, to diagnosis, and the appropriate therapy of patients, even at their home. Again, driven by digital solutions, driven and supported by advanced software and data analytics. Extremely important in order to support the challenges that we have with COVID going forward, sharing information. An extremely important initiative that we are also participating in is the VODAN initiative, providing fair data in a way that can be shared across the globe, making it available across the globe, with particularly Africa and Asia taking the lead in creating the solution, and then also ensuring that we both provide the necessary infrastructure and support, but also take into account the global regulations, where again the mobile use of data and the ability to do distributed and remote learning applications of algorithms are also very helpful here. And the example I gave before of the Indo-Dutch collaboration. Very important there is to bring that at the global level. And again, I mentioned at the beginning, this is not something we can do alone. There we work within as one of the initiators of the Digital Connected Care Coalition, where together with partners, we really open up, we democratize solutions across the globe, really with an ambition to connect both private but also public partners, financiers, because healthcare needs to be paid for and become affordable in order to address healthcare needs across the globe. And again, build on partnerships to reach these goals in a global way. With that, I hope I've shared some information of what we are doing and where we are helping and supporting people across the world, providing access to care, which is a fundamental right, taking into account, of course, that there needs to be a high quality of care, but also that it's appropriate and affordable, cost and efficiency, driving operational performance, addressing the needs of many, where there's a shortage of healthcare professionals, doing that in an end-to-end way, covering the patients from beginning to end. And there, we need to make sure that the applications are appropriate, of course, develop that in the local context, making sure that the models of healthcare delivery are most suitable to the healthcare system in which they are implemented, really providing networked care models. And so innovating together with the partners in the health system in such a way that we can help patients and customers. Thank you very much for the attention and allowing me to share some of the work that we are doing with you.
Thank you. Thanks a lot, Dr. Hans. And it's really pleasure to listen again what AI and in more general what Philips is doing. And you highlighted really what are the healthcare challenges. And it's not like a silo system. It should be in the networker system. And happy to see the portable ultrasound, what you are talking about as well, which is really need of the hour in the COVID-19 applications. We have one question in that is, what are the challenges you are seeing? Because we have developed a lot of models, and then what are the challenges you are seeing practically when you are deploying the models which we developed in the research labs?
Yeah, of course, and that's why I showed also the example of our collaboration with Narayana Health. It's very important to validate the outcomes of the work that was done. And so an algorithm or a model does not have any meaning if it has not been thoroughly tested and vetted in practice. And so whatever we develop, of course, we do that also together with healthcare professionals. And together with them, we test and validate the applicability and the outcomes that we are creating. And so always it's important to take the approach, and that is not only the technology or the science in developing the algorithm or the application, but it's also to make sure that it really leads to improvement and desired outcomes in practice. And when you do that, obviously, automatically the value becomes clear and the model can be put into practice.
That's great to listen to that. So thanks a lot on behalf of IEEE. It's our pleasure to share this virtual memento to you. And thank you very much on joining on an early morning, 6 a.m. from your side.
No worries. No worries. We have a long day ahead of me.
Okay. Have a great day.
Thank you very much. You too. And a very successful conference.
Thank you very much.
Bye-bye.
Bye. So with this, we'll move. We are in virtual world. We are moving from Europe to Australia now. So maybe evening for Dr. Bhuya. It's my great pleasure to introduce Dr. Rajkumar Bhuya. He don't require an introduction, but it's my humble way to introduce him. He's a professor from University of Melbourne, and he has finished there in Australia from many years. So he's even a founding CEO of Manjura Soft, a spin-off company from university. And more interestingly, if you see his credentials, he's an IEEE fellow, and he has excellence in innovative research award by Elsevier and the best of the world in computing system field. And if you see the citations, it's mind-blowing. So it is 1 lakh citations plus, and with the 750 publications and 7 textbooks. Without further ado, let me invite Rajkumar Bhuya, who is going to talk on Neotrek frontiers in cloud and edge computing. Welcome, Dr. Bhuya.
Thank you, Sunil, for your kind introduction. Of course, I'd like to thank you for inviting for this exciting event. And of course, I also thank Divya, who initiated this process of inviting me. So it is a great pleasure to be part of this event. I believe you can see my slides.
Yeah, we can see your slides.
Yeah, sure. Thank you.
Yeah, so you will have 22 minutes, and then maybe we'll take towards the end a couple of questions. Thank you.
Sure. Thank you. Thank you very much. I was told that this conference is going to focus more on AI. So then I end up proposing that cloud computing for AI applications. Then I thought a bit more. Then I thought, why just cloud for AI? Why not AI for cloud? So today I will briefly talk about a few advances in cloud for AI and talk about application. And I see previous speakers have already touched on many interesting healthcare applications where AI can be applied, and obviously clouds and Internet of Things play a very important role. So to be precise, I will discuss clouds for AI and AI for clouds, and see how they are made for each other. So I will quickly introduce you computing paradigms and their applications. I think this audience doesn't need much of that introduction, but I'll be very brief there. Then I will introduce you advances in cloud in terms of the services that are made as a pay-as-go basis, but however, the service need to be delivered in a cost-efficient manner, and resources need to be utilized very efficiently. And then, of course, harnessing the latest technologies to make the systems efficient, and also provide ability for composing applications rapidly. So that will be the focus of my the second part. But there, I will discuss about 3 applications where AI techniques like machine learning and deep learning are used in healthcare, in object detection, like surveillance application, and also in analyzing this COVID research data and find out insights. Then I will switch to AI for clouds. So briefly talk about why we need them, then how we could do it. So very briefly, then of course there are pointers to further information we'll discuss, and little briefly directions. So we all know that we have already went through various computing paradigms, and today is all about cloud and IoT, various class of computing services available on a pay-as-you-go basis. Not only compute but application services in different domains. So cloud provides a very flexible virtualized environment. Then, of course, with the emergence of Internet of Things, the more and more applications pushing towards cloud. So that also faces challenges in terms of providing real-time services. So this is where the notion of edge computing comes into picture. But I decided to take that part out and focus more on the use of AI in cloud or edge resource management. Then, of course, obviously, all these advances in computing that we see during the last 50 years were driven by many big scientific and military applications. But today, the focus has shifted towards big population applications, whether they are healthcare or social analytics or even the business application, providing real-time prediction and offering very customized services to large number of users. So that is a shift that we see wherever you see in the conference when they talk about technology, when they talk about application, it's all about massive number of users and how can we support them at lowest possible price. And we all know that clouds offer services that are subscription oriented. You as a user, you subscribe to those services and use and pay for what you consume. And obviously, as a consumer, you subscribe to a service provider one. That doesn't mean that the service provider does everything for you. So that service provider may be using service from other providers and putting them together and offering you a composite service. So this is something very unique and very important as a recent advances, particularly to support large-scale application with providing reliable services and providing real-time services. So utilizing multiple geographically distributed resources. And many real-time, many applications today that we see on cloud, they already follow this architecture, which is good news. And looking at the cloud application, here are some, but I want to switch towards AI-oriented application. But here also AI techniques can be used in some of these applications. See, the traditional CRM, customer relations management, and enterprise resource planning software systems, traditionally you need to buy from a large vendor and set up your own facility. But that has changed thanks to cloud computing, where now you can subscribe, even if you're a small and medium business or a startup, which is now big trained everywhere, including India. So they can access to this capability capability as a pay-as-you-go based service instead of investing upfront huge amount. Then coming to other applications like this social networks like Twitter, then of course Dropbox, then this the big social network applications like Facebook, they are already being hosted on large-scale distributed cloud environment, which are distributed around the world. Then, of course, applications like this video conferencing. Today, we're using Webex or Zoom. So these all are cloud-enabled, cloud-hosted application. And why are they hosted in the cloud? Because number of users can on these applications can drastically change with time. So initially, there might be just a few hundreds, and they become few thousand. They become 10,000s or millions. So when you have a large number of users constantly changing with time, you need a flexible environment, a computing environment that can be provisioned as necessary to support the application. So this is how the cloud is, gained huge popularity for all these applications. Then now I think in everybody's mind is only COVID. The coronavirus is there. So because it is threatening their life, threatening business environment, threatening economy, then obviously education is also disturbed so much due to this COVID-19 pandemic. So I thought we should do something in this direction, make a little bit of our contribution in helping advance the field to deal with this COVID in some way. And coming to AI, of course, there are many applications of AI that you all know in healthcare primarily. These days, we discuss so much about it. Then, of course, the AI application robotics. The field of robotics has been around. And if you go back to maybe last 30 years ago, when we were studying at that time, people used to teach AI, but in the context of expert system and AI robotics. But of course, now still they're talking about AI and robotics, but not so much about robots in in manufacturing sector. But these days, people talking about robots as spouse. Somebody says by 2030, 2050, you can marry a robot, and robot will be just like your spouse and responding to you, your needs. And then, of course, each person has different requirement, and then AI will be trained, and the robot will be customized dynamically just for your own happiness. So this is what people are talking about. Apart from taking, other areas where AI can be applied in surveillance, in finance, in entertainment area, and of course, in recommendation system, we need them. And why do we need then cloud here? So this is because all the AI applications are heavy, compute heavy, and also data intensive. So for example, when you think of AI application, for example, some machine learning or deep learning techniques, especially machine learning, you need to train these systems before they can be useful to us. So, for example, in recommendation system, very commonly used in e-commerce and many other areas where a large amount of data need to be trained, that system need to be trained, that training itself takes a lot of time. Then after that, for example, when you want to detect some pattern, an object, so you can pass it and give it to the trained model, and then that will give you answer. And this same thing applies to, an NLP, natural language processing, and so on. So, of course, looking at healthcare, these robotics can be applied, and AI can be applied in many areas, including making right decision in a timely decision, in diagnostic and treatment. So there are many of these areas where this AIs are playing important role in helping improving healthcare. And you heard a lot about it already from our previous colleagues, from Philips and other colleagues that I just noticed. So coming to cloud, what advances are happening to support such applications? So particularly, I'm going to discuss about our own work in this area, and then talk about some of our recent works that apply AI and in the context of also the COVID situation that is facing the world. So this cloud is a market-oriented, infrastructure. So because where services are priced and then offered to users, so therefore the way we manage this infrastructure has to be market-oriented, economically driven. So at the bottom, what you see in a cloud environment, various compute capabilities which are virtualized, available to users on a pay-as-you-go basis. Then of course, not only compute, even the network is virtualized through software-defined networks. Then the virtualization from the concept of virtual machine has now shifted more towards containers, where you are able to offer microservices. So these microservices are a great thing in terms of ability to create scalable applications that can offer reliable services to consumers. So at the bottom level infrastructure, when you go up this stack, what you see is end users with different requirements, and these end users make a request to cloud. So you can't really offer every expectation of every user. So users have some certain requirement that is called quality of services. When the request comes in, there is admission control system within cloud must see whether the request can be honored as per the QoS requirement. If yes, then you admit. Once the request is admitted, let's say you got a virtual machine on which application is running, then of course that application may be initially serving some 100 users. With time, number of users can increase. When number of users increase on that application service, so what do we need to do? So if you just continue to offer using resources that are provisioned in the beginning, the system won't be able to deliver the quality of service that users are expecting. So what do we do? So we need to provision extra resource from within one cloud data center, or maybe across multiple cloud data centers or multiple cloud providers which are geographically distributed. And this is very, very important because the users for these application services can come from anywhere. And today we are in this WebEx or a Zoom or whatever you're using. So these are cloud hosted video conference services. The users are coming from all over the world, coming from we just had from Europe, from Australia and other countries. So when the users are joining in, and to provide them the best response to all the users, the resources are provisioned dynamically, and then maybe the virtual machines or resources that are provisioned are placed in a data center, cloud data center, very close to the user, so that way they can get the best response time, and the presentation can be as real time, as smooth as possible. So similarly, you can apply the same concept to healthcare and other areas. So then obviously here also we need to minimize the cost of computation. So by harnessing services offered by different providers at lowest possible cost. And the other problem that we also see is when number of users decrease, that time you also need to shrink. So this is called elastic property of cloud, where you are able to expand or shrink in dynamic manner to meet this application requirement. By doing this, you are able to enhance the resource efficiency. Then also, these cloud data centers worldwide are consuming energy more than entire India. So huge amount of energy, electric power is consumed. So we can harness that power by managing the resources better. So this is another important requirement of a cloud environment. So in this area, we need more advances. And soon I'm going to discuss about how AI can be used for that purpose. So meanwhile, let us discuss about a cloud application platform that we developed, and then in the context, and then I will discuss particularly AI application. So here is our cloud application platform called Aneka. So this allows you to build applications rapidly, and to support varieties of application composition, Aneka comes with two key components. The first one is called SDK, Software Development Kit. So this SDK contains different type of APIs like thread model, task model, MapReduce, and like that. There are many ways to create application, and different application has different characteristics. Accordingly, we need to choose the right model to create the application rapidly. So that is what Aneka's SDK focus on, Software Development Kit. And once you build the application, you can deploy on a private cloud or a public cloud or multi-cloud in a seamless manner. So this way we can enhance the productivity of software in developers. If software developer has to focus on developing, here is application for one cloud, here is another for another cloud, then of course, if I want to use multiple cloud data center, then I have to change. So this is all too much for a developer. So we need to hide all this complexity from end users. So this is where Aneka provides you all those seamless APIs, and we have runtime machinery that takes care of deploying across all of this type of cloud environment. So we support Amazon, we support Azure, and of course, we also support the local private cloud that are created by users using standard bare metal computing or on a virtualized private cloud infrastructure like OpenStack based. So when I go deep inside Aneka, what we see is a container-based service that hosts various foundation services, and these foundation services are used to extend and support creation of new models of programming like thread, task, and MapReduce. So this is an extensible programming environment. So tomorrow, if you have a new idea for a new programming model for AI, you can create one. The existing ones are too complex to build application. So therefore, you are come out with a new model of programming. You can extend our Aneka foundation services and create a new model of programming. So this is how we support innovation in computing. So this is the world first platform that provides multiple models programming, but also this architecture that has this ability. So this is what it makes it unique. And as I said, you can deploy in a private and public cloud in a seamless manner. So this Aneka has been around, but what is new? During the last 10 years, we extended to meet different applications. But today, so we have Aneka new version called Aneka 5G, 5th edition of Aneka. This primarily focus on applications related to AI, deep learning, then of course this IoT-oriented applications. Then particularly this multi-cloud capability to be able to compute across multiple cloud in a seamless manner. So here are the few plugins that we developed. As you know, every cloud infrastructure has its own access interface, its own APIs. So you can't expect every application developer to build it for each and every infrastructure. So to hide hide the complexity from end users, we have developed software adapters or plugins that talks to each of those infrastructure like Azure or Amazon or OpenStack APIs or VMware, so or your just standard bare metal computing interfaces. So this way you are able to utilize those in a seamless manner. And as you know, for example, even in case of electricity, so if I just come with my laptop to India, if I try to plug, it will not work. So therefore I have to bring an adapter, because the Australian one, this pin look different. Then if I go to UK, it is different. If I go to America, it is different. So this is all made possible through adapters, electricity adapters that allows you to consume the power. You connect to a laptop to power it seamlessly. Similarly, to power your application, to be able to harness those clouds, we have software adapters that seamlessly provide you this capability. By doing that, you can enhance not only the cost of software engineering, but also if you're deploying on different cloud environment, so we can minimize the cost of computation, because different providers charge different price for the same services. We have cost optimized algorithm that allows you to do this. So this system has been applied to many areas, and here are the few from China, so the railways. Then of course in India, ISRO uses for where you can harness multiple capabilities from multiple ISRO centers for applications that are critical. Then Washington State University in the US, they build a deep learning library methods that classify medical records into sensitive and non-sensitive. And if you've got sensitive records, you process on a private hospital cloud because it's a privacy requirement. And if there are some medical records that are non-sensitive, then we can use the public cloud. So they are able to plug in such a model to Aneka and use it for such medical data analytics. So like in Thapar University uses for agriculture application data analytics. Then of course, so soon I will discuss these three areas where you can apply these techniques for healthcare, for deep learning and COVID-19. So there are many examples of application. So in interest of time, I'll just briefly discuss 2 or 3, then we conclude in the end. So here is a healthcare application. Healthcare means integrating sensing, mobility, and cloud, and then of course applications running on a cloud. So here is there are healthcare sensors that capture the data, and then from there you send it to mobile phone. The mobile phone, a mobile app from a mobile phone can take data and then use cloud service for analyzing the data. So here, for example, so ECG, electrocardiogram data analytics service running on Aneka on top of some public cloud like Amazon or Azure, whichever you choose. So then here the users that are there, the user can come with different quality of requirement. Some users with emergency requirement. He says, here is my healthcare data. Please process and give me answer in 5 minutes. I will pay 20 rupees for this. So that is the QoS requirement from end users. Then the request comes in. Like this, other users also submit. Another user might be, hey, here is my data, but give me answer in 24 hours. There is no hurry, but I will only pay 5 paisa. So like this, different users coming with different QoS requirement in terms of timeliness, in terms of the price they're willing to pay for it, for the budget limit. So when the request comes in, so here is Aneka, that is the market aware, looks into services, then organizes this request in such a way that we are able to deliver those users to services to the users as per the requirement. For example, the requests which are relaxed deadline and they are delayed, whereas others are quickly done. So this way we are able to deliver just like in a market-only system. So the healthcare system, so this was applied, and then we have shown this demo, several places in international conferences. So here is the we connected sensor with the person hand, the data sent to mobile phone, and then from there is sent to cloud, and process results came back. And just by looking at this graph, you can tell about a lot about person status. So for example, this can be used to find out how many hours this person has slept yesterday night. So this can be a good data for admission control at a conference. If someone has slept for less than more than 4 hours, you can admit them. If someone has just barely slept yesterday night, what can you do for them? If you admit them into conference, especially in a physical conference with air-conditioned room, the people fast sleep. So in which case, what we can do is someone has slept for just 2 hours. So we can identify such a person. Hey, why don't you have this masala dosa and a puri, and then you can take rest for half an hour and come and join us after half an hour. So this is another example. But you can apply this to many other healthcare application areas like diabetes management and so on. So this is just an example I want to illustrate. Then the surveillance and security. So this is another application. So so here object detection. Like images are captured and videos are captured through different IoT devices, and then they come to the cloud. But obviously you need to do this in real time. So this is where deep learning libraries are used to analyze. So IIT Delhi has used our Aneka and then created a distributed version of this deep learning library, deep learning application running on private and public cloud in a seamless manner. And you can see they're able to classify, for example, images that are coming in computer labs into, oh, here are the number of people in this computer labs. You can easily see who is in the lab, who is not there in the lab. Attendance you can manage automatically, or you can see do we have other computer that we purchase in the lab or not. So like this surveillance, this is a simple example of how you can use. Then final example of this Aneka is using this, analyzing COVID research data. As we know, during last nine months, more than 130,000 research papers are published. Mind-boggling. What can you do? I want to analyze and classify them into categories, or maybe I want to find out what is the effective social distancing, which is the best proven one. Can I adapt and deploy in Karnataka or in Bangalore? So this kind of analytics requires you to go through all these papers to make that job easier. So we created this machine learning libraries that analyze this data and classify those data into like a ranking, so that you can choose one which is suitable to you. So this computing on obviously Y cloud. Obviously, we want to get the answer in real time. So if I do on my laptop, it will take 2 days. I want to get answer in 5 minutes. So I can harness the power of multiple nodes in a cloud, and Aneka helped achieve that. So this, if you want to learn more about Aneka, just visit mandrasoft.com. So you can click on download. You will be able to download the latest version of Aneka. So many users around the world, including India, are doing many interesting works in this area. Then obviously in education sector, IEEE is big in education. So many universities throughout country have introduced a cloud computing subject. Obviously in engineering, we also need a laboratory. So many of them have set up Aneka based laboratory and teaching courses in cloud computing, not only teaching the subject, but also using it for innovative projects in machine learning, in image processing, and so on. So then this is my before I conclude, I will briefly touch on. So that's about applications enabled, powered by cloud computing. Now, what about AI applying to cloud? So why do we need it? And if you look at this cloud environment, they have become massive and complex. And the way they are managed today, up to now, we're mostly using, massive, then difficult to manage. And they're also, as I said, they are being set up in a geographic distributed environment, especially to harness this smart star application, this IoT-enabled application in autonomous cars, in smart city and healthcare. So these are called edge AI analytics. For that purpose, they are being set up, but managing them is very complex. Why is it complex? So because it's large scale, plus then the varieties of workload, plus of course the techniques that are used today are very static oriented, or the way the resources are provisioned, they are very reactive oriented. So we need a better approach that are proactive oriented. And also, as I said, these cloud data centers worldwide are consuming energy more than entire India. Please take a note. This is very serious matter. And how do we minimize this energy consumption? Requires a very deeper thinking in terms of computing, in terms of computer science research. Plus, by 2030, it is estimated that all this digital transformation occurred, and then this COVID-19 has actually, pushed more and more transformation in utilizing IT technologies, cloud technologies for various of application. And today, the remote office has become a new normal. You don't have to go to office; you just work from home. So, which means it is putting a lot of pressure on cloud. And then by during last 9 months, the usage of this cloud data center increased by 32%. Compared to last year. So this means the energy efficiency is becoming a very, very important goal, and in terms of climate change, very important. So there is a lot of work to be done in this area. Since we don't have much time to discuss about how to do it, this is an area is very close to my heart, and I would have spoken for a day just on this topic only. But in interest of time, and I see Dr. Sunil is already up. Maybe he's giving me already a hint that I need to conclude. Okay, so. Then here is the AI-centric model, for cloud resource management. What you need to change from the static heuristic approach towards AI-centric, wherein the resource management system itself learn about users, learn about things, how they're going, what is working, what is not working, and how can I reduce this energy. I still provide answers to services to users as for the quality of service requirement. It is not just the cost of compute, but also the energy cost. Energy cost is increasing, as we all know. If you go look at the KEB bill, I hope Karnataka Electricity Board is still there. When I was there in India, KV bill we used to get. The KV bill, you consume the same amount, but everywhere the bill is increasing. But whereas in computing, you use the same computing capability. Everywhere computing capability is decreasing. I mean, the price is decreasing, capability is increasing. So we are doing advances, but the other areas are actually putting a lot of pressure on us. We need to minimize that, and the digital transformation that is occurring in all these areas is very, very important. And particularly with this edge and multi-cloud, multiple networks, we need to manage them with this model. And recently we have done work in this area and published a couple of papers, so you can see them more detail. For example, if I want to go a little deep inside, how does it look like? So essentially, a lot of servers are there. Cooling systems are there. We need to monitor how they are doing, then get the data, then obviously and feed it to this RL based deep learning, reinforcement learning method. So which uses all this requirement and then continuously sees, okay, last time I did like this, because of that I performed this way. No, maybe something didn't work well. So that becomes a feedback, and then I learn dynamically, then make an action. So this is just like in a real life, just like a child. When the baby touches a fire, or it burnt hand, now it knows that better not touch this fire. Because in the beginning, they like to touch. And if you ask them to not to touch, they like to touch. So let them burn a hand also. So this is exactly a similar model, but you learn from this complex environment, because the cloud data centers contains almost millions of servers. No single person technique can learn about all those millions of servers. So that is why we need such approaches. Okay, so let me conclude, and then of course we can, if I save some time, we can have discussion more about it. Okay, so there are several computing models have promised how to make computing as utility, and this cloud computing is the one which is prominent in turning this vision into reality. Then we already see many exciting applications of cloud computing in many areas of society and industry and government. But obviously today AI-centric applications are very heavy, and then the more advances in computing is now driven by AI. For example, not only just cloud, but also even the CPU. There is something called TPU. The TPUs are the new CPUs for AI. Okay, so that means people are serious about this area. Then GPUs are there, but more than GPUs more numeric computing application, but AIs are combination of numeric, combination of data. So they have their own characteristic. That is why even the company like Google pushing to this TPUs rather than CPUs. But anyway, coming to software engineering, the application engineering, the engineering of cloud application has to be quick, and then we should be able to do that engineering application rapidly with the minimal time and minimal effort. But once you build, you should be able to deploy. So this is where our Aneka comes into picture. So supports rapid software engineering and deploying on clouds in a seamless manner. And we have demonstrated this technology through many applications. Our customers in China, in India, in Malaysia, in other countries have done very interesting work. So I've just presented very briefly, but I've just picked up those applications in healthcare context or COVID context, because our mind is now focused on COVID. Okay, that's the only reason. Otherwise, no other reason. Otherwise, I would have talked about how that's ISRO is using, because we are not so much focused how to go to moon at this moment. We just focus on how do we survive right now. Correct? Yeah. So of course we talked about cloud AI and AI briefly. So you can see cloud does help AI application. Then obviously AI also helps cloud. So there is a lot of work necessary. Okay, so if you want to learn more about cloud, all of you are experts coming from industry. But those who are in the beginning, here are some books, to read. So this Mastering Cloud Computing American edition. The colleagues who are in America, like our Dejan. So Dejan has written a endorsement statement for this Mastering Cloud Computing American edition. But come to India, of course, American edition is $100. It's not affordable to India, especially under Modi government. Modi is very strict with budget. So we better use India version, make in India edition, $10. Then of course, if you go to Chinese don't like any of this. We need to have their own version. So for them, $2. So I can tell you why there is $2, but there is a separate history. So this affordability is also important. So make sure that when you build cloud services, and the pricing has to be affordable to the consumer. A cloud consumer in Bidar, price has to be $2 per service, but the similar consumer in Bangalore, it is $20. So like that. So how to do that? This market principle. This is interesting. Okay, let me stop here. Great. Thank you very much for opportunity to share and present, so we can have some interaction. Thank you.
Sure. Thanks, Professor. It's actually I lost track of the time as well. It's interesting to see from your perspective, diversified perspective. More interesting for me is how you are using that NECA in different countries for different applications, and interesting paradigm of AI for cloud and cloud for AI. So happy to see that. I have one question before we wind up officially. What are the security issues you are seeing in the cloud thing, right? Because some of the domains they still see the cloud adoption wise, all the industries are not taking it the same level. So if you're talking from the security aspects, what are the challenges you see?
Yeah, so obviously, the first one is the legal constraint. So if it's the healthcare area, so if the data is captured in Bangalore, and perhaps some of the government policies dictate that you don't put that data in somewhere in America or some other country. So this legal aspect is one. So this is very prominent in other countries like in Germany, and where this data locality, data ownership, and where they are stored is very important. The next is privacy aspect. So privacy, if I put this data in a remote place, how do I can assure that this privacy can be managed? The third is the security. Even if I'm not bothered about I'm okay with the privacy, but what about security? The integrity of the data set. Then if I put this data on a cloud, so will the cloud provider seize my data? So what do I do about it? So this is where people are talking about encrypted computation. So can we, so for example, the data captured through a sensor here. So I encrypt this data and send it to cloud. I store it in a cloud, but I don't want the cloud provider to see them. So what do I do? I encrypt it and put the data and transfer through encrypted data. This will run on the transit when the data is moved from me to the cloud on the way in the network. Also, nobody should tamper it. Once it reaches the cloud, I don't want their administrator to see this. So therefore, how can I compute on encrypted data? So these are the areas people are looking into. Then right now, I think, as you said, this is one of the block for success of this cloud. So we need to make them really secure, really controllable, really manageable. So it's a big issue with, especially with the emergence of IoT. So ethics also, of course, another area is endless.
Yeah. Great. Thanks a lot, Professor, for covering under the theme of AI for social good. To reach to the masses, definitely there is a good role of cloud, and you talked about a lot of challenges and opportunities in that. So with that, it's our pleasure to offer our virtual plaque from a token of appreciation from IEEE.
So just a minute. So let me take at least virtual plaque photo.
Yeah, we will share it to you as well.
Yeah, but real time I have it now.
Yeah. Yes, great.
But I have used ads, ad service.
Great.
Thank
you very much, Professor. Thank you very much, everyone, for joining. And this is the last session for today morning. So it's an opportunity for me to host this session 3 on AI for social good. And we have power packer sessions of 4 keynote speeches and 2 panelists. Let me take the opportunity to thank everyone. And let me invite Puneet for any closing comments.
So I'm audible?
Yeah, now you are audible.
Yeah, I'm having some network issues, so that's why I am asking whether I'm audible or not. So thank you, Sunil. Thank you very much for your excellent moderation, I can say. And thank you, Dr. Bhuiya, for accepting our invitation and providing a wonderful perspective on cloud for AI and AI for cloud. So this concept is really nice, and you provided a lot of information, including your Aneka. And I can see that in India it is highly popular, so we are using it extensively. Now summarizing the session, so this, as Sunil rightly told in the beginning, that we were having a presentation from 4 continents, starting
we are losing you in between, Puneet. Is it for me or for everyone? Puneet, we cannot hear you. Maybe some network issues.
AI for
Yeah,
social
now it is
good,
better.
and then second social AI for social good from design. Who talked about digital health technologies supporting access to care. And at the end, again, we just now finished Rajkumar Bhuiya's talk, who spoke very nicely on so with this completed of BTC and thank you all the keynote speakers for joining us and encouraging us for doing this wonderful thing. And thank you, Sunil. Thanks again. Let us break for the day, and in the evening again we will be meeting with our last session, which is going to be on ethical AI. Thank you, one and all.
Thank you. Have a good
thank
day.
you very much, everyone. Sunil and Divya, of course, colleagues for inviting. So it is a great honor to be part of this event. So just a quick question or clarification. So are you guys recording this presentations?
Yeah, we are recording it and we will make it. Yeah, will be shared on the YouTube and we will share you the links.
Thank you very much. Thank you.
Thank you.
Yeah, obviously I had joined earlier, so it looks like program is very, very exciting and interesting. So it put together very interesting speakers from all over the world.
Great. Thank you very much.
Thanks.
Thank you, everyone. Bye.
Bye.
Thank you, Dr. Divya. Thank you, Dr. Sunil.
Thank you. Thank you, Maria.
Thank you.
Bye.